Thanks, everyone. Please welcome Dr. Stephen Russell.
Thank you so much for having me here. I'm so excited to be here. And actually on this theme, well, I'm already getting myself out of order, but speaking of youth art, this is a great piece of youth art that became the cover of this National Academy's book on the promise of adolescence. But thank you, Center for Health Equity Research here at NAU and Arizona Department of Health Services. That's terrific for supporting this. And it's great to be here at CHER Arizona, at CHER Arizona. That's what you can tweet, I think. And I'm from UT Austin. I'm also affiliated with the National Center for Adolescent Development, for the Developing Adolescent. And what I want to do today is talk with you about this report, The Promise of Adolescence. It was released in August 2019. You might know that, 9 months after that, we all went into lockdown. We had been anticipating a lot of communication about this report in 2020 and 21. And so I'm glad to be talking about it again. This was a major report issued by the National Academy of Sciences, Engineering, and Medicine on understanding adolescence and the promise of adolescence. And so I thought that this was a group that would be interested to hear what I think are the really important takeaways, especially with respect to health equity, said by this is now from the national academies. And I feel like that is a really important thing to underscore. Like, it can never be unsaid by the National Academy of Sciences. And there's some things in this report that had not been said before from the scientific authority of the National Academies. So I want to tell you about this report. And I thought I would start just quick. I can't tell a short story, as Amanda probably knows, and can tell you, but I thought I would quickly explain, because I was invited to be on the consensus study for this report, and I knew about, I'd heard of the National Academies, but I didn't really understand. I thought it sounded fancy, and it's an important thing, but I didn't really understand how the process worked. And I think I'll just want to share with you that the National Academies was created by congressional charter. President Lincoln, when he didn't have other things to do, was doing things like creating the land-grant university system and creating things like the National Academy of Sciences to advise the nation on issues of importance to the well-being of the people of the country. In 1863, and it is a nonprofit institution that was created by the government, but it sits aside so that it can be independent and objective and provide analysis to the nation about things that matter with respect to science, technology, and medicine. The aim is to help policymakers and all of us make informed decisions based on unbiased, authoritative, evidence-based information, the latest science. And there's this elaborate process, and there are all these. So these are National Academy slides that I'm using that I have adapted, because do not blame me for all the text. You'd think the National Academies would have attended a workshop on best practices in PowerPoint, because this is not even the beginning, but I've really tried to pare it down. But I have 3 slides on the consensus committee. The consensus report is issued as a book, and it is the most authoritative statement that the National Academy makes. The National Academy hosts workshops and briefing papers, but a consensus study is the most authoritative statement from the National Academy, and that's what this is. It's the first in many years to focus specifically on adolescence. It's a committee of people that are vetted, and all this complicated stuff. Look at this, 3 slides on how they determine the scientific integrity of the committee. So just trust me. It's a complex process. Bunch of people get in a room multiple times, like 5 times over the course of 2 years, to really try to grapple with understanding the evidence. And by definition, by composition of a very diverse, scientifically diverse team of people, we really deeply debate what is the limits of our evidence and knowledge. And I share this quickly because what I'm going to feature are the recommendations from this study, but the National Academies has a very elaborate and charming set of definitions for the distinctions between a finding, observations based on facts, a conclusion, a judgment about what we think we can discern from the findings, and the highest bar are recommendations, the thing that we believe evidence tells us we should take action with respect to. So what I want to share, what I want to preview to you is I'm going to talk about the recommendations at the end of this talk. I'm going to talk about the health related recommendations, but I want to underscore that these are recommendations that have met this criteria that we think are actionable for the government of the United States to take to improve the well-being of the lives of all of us, but the lives of young people in this country today. The sponsors for this study, The Promise of Adolescence, came from this group, this amazing group, the Funders for Adolescent Science Translation. It's a group of philanthropic organizations that have come together and are concerned, their motivation was concern for a mismatch between what the science tells us and what sort of community lived information and beliefs about adolescent development are, and how that informs practice and policy. And so this group of funders wanted to support the national academies to bring people together to think about really understanding. One of the things that we struggle with around communication is that we have such tropes, such deeply ingrained tropes, particularly about adolescents and what they are. And you'll notice I have not said some of the words that are the first ones that come to the minds of most people, because when you say those words, it triggers our understanding of what that means. We're talking about the promise of adolescence, which is an explicit rhetorical move that shifts, trying to explicitly shift a conversation in this country away from risk and vulnerability, away from those naughty kids in that terrible life stage that so many people think we want to avoid. So we're thinking, and we believe, actually, we don't believe, the science tells us that adolescence is fundamentally a period of promise and of opportunity. These are committee members, and again, these are not my slides, but you can see that the idea is we have people from economics and medicine and policy and law and practice and government backgrounds, child and human development education, sort of a whole range of fields. And it was an adventure, for example, trying to collaborate with the different perspectives of even what counts as evidence across such diverse fields. Was an interesting, there's a whole section of the appendix of the book where we discuss what we mean by what the criteria for scientific evidence was for our deliberations. And there's an important staff, incredible people from the national academies who dedicate themselves. So the purpose of this group, so the academies charged us with a study that would come from the national academies to provide an evidence-based report that would really examine the neurobiological and social behavioral science of adolescent development. The context is that there's such an explosion of brain research that has been so isolated from, this is my take, but this is not really, has been isolated in many ways from the mainstream of adolescent science, which has been social and behavioral and cultural, and has been so misunderstood by the general public. How do we bring these together, and how do we explicitly understand early life conditions and how they shape adolescent development? Specifically, how do we understand structural inequalities that shape the pathways to well-being for young people? And then what does the science tell us about what we should do, like the systems that shape the everyday lives of young people? And so in this report, we focus on health, justice, education, and child welfare. We talked for a long time about whether to even take that approach, because most of us on the committee wanted to think holistically, and yet we realized that so much of the action with respect to policy and practice takes place in these, unfortunately, sometimes siloed, institutional domains. So with that critique of our cultural framework, we made recommendations in those areas. And so part of the broader context for this, I've mentioned this interest by the funders in moving beyond risk, but think back to over 20 years ago, some of you will be familiar with, or at least have heard of Neurons to Neighborhoods, which was it was another report like this one, but it really changed. It was an example that the academies uses a lot as a report that changed the game, that created a public conversation that really altered the course of early childhood investments in the United States. And some of us now, we don't even think anymore about how much we have now focused on early childhood that was non-existent before that. Think of like the Arizona tobacco tax is like, despite the 20 years of troubles now, or dilemmas with how that's actually working in effect. These investments have really changed the stakes for early childhood. And what is frustrating to the adolescent sciences is that early intervention is not just, needs to be an investment and is not just the cure, and that the investment needs to be sustained across the early part of the lifespan, and that we need to extend that strong infrastructure for children. And that, in fact, there is pretty good evidence that some of the important investments get, there's clear evidence that some of the important investments in early childhood become undermined if they're not sustained across the course of adolescence. And it's also fair to say that that report came out, 20 years ago in a context where we really had a different science, a completely different neurological understanding of adolescence. I mean, we really did believe 20 years ago. I mean, I taught adolescent development. I taught a whole generation of students the wrong thing about brain development. Like, we really believed the famous texts said to undergraduate students that the brain is really pretty much cooked by the time you're 6 years old, 3 years old really. And that what adolescence is about is experience and exposure. And that is what explains differences in adolescent behaviors and patterns of development. And what the neuroscience is telling us is radically challenges, or not even, completely flies in the face of that kind of assertion. And so this investment in early childhood, which has been so important, and I'm, completely think it came before we really understood that is the first of the two dramatic phases of the, arguably three when we think of end of life, but the three dramatic phases of brain plasticity are early childhood, adolescence, and end of life. Plasticity, if you think, well, it's not really plasticity, we would use a different term, but in terms of dramatic brain development and change. And we didn't know that when Neurons to Neighborhood came out. So anyway, this is a point about we need to sustain an infrastructure for the first 25 years. And we can't just do 0 to 3 and let's be like, okay, that was easy, or it wasn't easy. Even that's not easy. So this is the sort of the why adolescence, and maybe I've already said all this stuff, the advances of brain maturation. I'm going to say a little bit about that. I got to tell you, I'm a sociologist, demographer, human developmentalist. And I'm afraid of the brain stuff. I'm not afraid of it, but I have been a skeptic for so long. I'm now a complete believer, but I was a skeptic for so long because I saw how I was also working in the field of youth development and saw how the brain stuff was really undermining, was really deeply undermining. They're like, oh, people, they just can't even think. They have no capacity. The prefrontal cortex is just making people run around wild. I mean, that has been the culture of how we understood the brain research, and it is absolutely inaccurate. So let's think about that. I think I've talked. So, but the other important thing about this report that I've mentioned about this report is that I'm so proud of the ways that we assembled the science to underscore the deeply rooted structural inequalities that curtail the promise of this developmental period. That adolescence is a period of incredible promise, developmental plasticity, and malleability and possibility that is completely thwarted in contexts that thwart access, opportunity, engagement for young people. So this is our, because we always we got asked a lot and we argued a lot, like, are we going to give it an age range? And are we going to, finally we were like, okay, look, we're the scientists who are going to completely bunt and say, no, we're not going to give an age range to adolescence, but we're going to acknowledge that adolescence begins with physiological, biological changes and ends with social and cultural statuses and identities. And that, I'm just saying it out loud, that lots of people would like us to come down on a number at the beginning and the end, but we're in this report acknowledging that early childhood, the beginning of adrenarchy, is the beginning of this thing that we call adolescence, because it starts the pubertal cascade, the beginnings of the physical and cognitive changes that then lead to the social, cultural, and frankly institutional structural changes that shape the lives of adolescents all the way into the through the period that we know that brain development is really solidifying into the mid-20s. So the structure of this report, and how am I doing on time? Do we, okay, I mean, it's because I haven't even started. This is bad. The structure of the report is that this is Google's Promise of Adolescence, and download it. It's free from the National Academies, the whole book. You can download the whole thing for free. So another thing great about the National Academies, you have to give them your email, but if you're going to be spammed by anybody, be spammed by the National Academies. I mean, I promise they only send you an email like once every couple of weeks about a new amazing report on climate change, for example, that you might care about, or on, you know, who knows what I should have looked to see what the latest consensus study that they've released. But this the first part of the book is kind of really framing adolescent development with a specific focus on inequity that I really want to focus on here. And then the second part is really how we use that developmental knowledge to assure opportunity for the promise that we know adolescence should be for all young people. So I really want to hone in both on the adolescent developmental piece and on inequality and health. And so I've probably said most of this already, but I think that let me see if there's anything that I want to say again from this slide. I think that it is the case that this preoccupation with risk has our cultural mistake is that we have attributed our understanding of vulnerability to people rather than to the context. And so some of you that are, my age or ish will remember the old, this is the kind of thing I'm afraid to say it because it triggers in your mind that idea, but it's like having a souped up engine with not a skilled driver at the wheel. How many of you have heard that? It's like having a race car, but not a skilled driver, which is completely crazy if you think about not talking about whether the road is paved, whether there are any guardrails, whether there are any street lights, whether there's been any maintenance, whether they've ever had driver's ed. It's not about the kid's brain. It's about the cultural investment, the societal investment that creates the possibility for that car to drive smoothly down a road in a way that's safe, right? I mean, that's what makes me so crazy about those ideas about the adolescent brain. So and I've said this, we need to, so let me tell you about this. This is Stevens, the sociologist, telling you, his interpretation of, well, I do know something about the neuroscience, but here's what's really amazing. And that really is, the reason I'm a convert about really trying to understand the interplay between neurobiological cognitive development and social cultural identity and experience is that there are these extraordinary changes, and I can talk about the hippocampus and the striatum and all that kind of stuff that I don't really fully understand, but that there are changes in motivation and sensitivity to reward, the sensation seeking that is real, contributes to a capacity for learning that that is developmentally adaptive because young people seek learning opportunities, habit forming behaviors. Yes. Can I minimize? Oh, I could. Would that be better? I'm not sure how to do that. I could just move it. Should I move it way over here? Yeah. Thank you. Oh, wow. Minimized. Perfect. But are you watching the chat? Do we know? Should I be?
No, you don't have to.
Okay. Oh, okay. Okay, no problem. We'll go back to this. So this time, and we know this to be true of adolescence because we all remember this part: the sensation seeking, the attraction toward the novel, the intensity of experience. These are important motivations that drive the capacity for learning. For habit formation, that's really important. Those are the things that we engage in that we are training ourselves to learn about. The issue is how do we create positive incentives so that those habits are contributing to positive behavior. Cultural neuroscientists are telling us amazing new things, and some of y'all may already know this, but that developmental growth and transitions in neural activity shape the transmission of cultural values. It's the development during adolescence of the neural possibilities that create the possibility for understanding cultural values. for things like preferences for social hierarchy are learned and ingrained literally in the brain during the period of adolescence. It's the time when our brain, the regions of the brain that are implicated in personality, identity development, in cultural attitudes and identities, even orientations. There's some really great, interesting neuroscience on cultural differences in the development of interdependent versus independent cultural orientations. Those are not products of, those are products of a cultural group that become actually part of our neurological biology. And then finally, improve the dorsolateral prefrontal cortex, that thing that we have fetishized about adolescence, can be changed. It's like the focus, the target now, there's great new work that is focusing on the prefrontal cortex as a target for prevention efforts or intervention to intervene in cycles, those habit-forming cycles, or promote positive habit-forming cycles. So interventions, we know, I mean, the beginnings of this are interventions that are using emotion regulating, practicing emotion regulation strategies, repeated practice and training that alter emotion, that possibility for automatic emotion regulation that is controlled neurologically. I mean, it's really super exciting to think that that degree of malleability exists. And what's also, I mean, the interesting thing is that it's adolescence. I mean, you know, the neuroscientists are telling us you don't really have that capacity in the same way when you're 35 that you do when you're 15. So this is the part where we need to figure this out, and we need to think about the context that young people are living in that provide those adaptive opportunities for that sensation seeking, that risk taking, meaning positive engagement in the stuff that makes them excited, but in ways that foster positive development and adaptation. So all of these things, it's so the excitement and then the dilemmas are that things like awareness of social status emerges during adolescence, but that and the institutions, practices, places that young people live in have the possibility to reinforce or to undermine ideas about stereotype, ideas about discrimination, for example. So all of these, I think I've said everything that I had sort of wanted to say, but ultimately the investment, you know, what the science is telling us is that the investment in programs and interventions to capitalize on brain plasticity is something that we really need to focus on. And could we imagine like sort of a 0 to 3, you know, a 12 to 16, that would be that at that level of societal investment on like, what would it really look like to engage in the radical, exciting possibility for adolescent development? I want to shift to talk about inequity. And this is the part where I feel like there's so much of that book that I've highlighted and that I want to put on, you know, I want to quote, because it's like not you and not me and not somebody else, but the national academies has said these things to be true. That the promise of adolescence is curtailed by economic, social, and structural disadvantage, by racism, bias, and discrimination. It makes me cry to think that we finally have scientists saying that this is true. We have evidence for it in the neuroscience and the cultural science, that we know that these determinants reduce opportunities based on advantage, that privileged people get more privilege during adolescence because they have those opportunities for positive reinforcement of the habits and the neurological circuits and the social behaviors that advantage them, and that less privileged young people are less exposed to those opportunities. And that this really literally gets under our skin through this changing neurobiology of adolescence. And that the disparities are cutting across the multiple systems that we know are the systems that I named earlier that shape the lives of adolescents, and that we see those disparities in every single, we know it's structural when we can see it every single where we look, right? So that's what it means to have a structural disparity. And the academies are telling us this, that differences in the sources of disparities come from three things. And we sort of group three general areas of the sources of these disparities. One is differences in family wealth and income and neighborhood segregation by race that is highly correlated with income. That wage stagnation has reduced family resources for investments in children, for family investments in children. And so we actually need more, you know, we have you know, horrifically decided that it's all on the family to provide the kinds of, to be the sole provider of the context for success and health, that racial differences in wealth are dramatically greater than racial differences in income. And if we just look at white households in 2010, 6 times the amount of wealth of Black households. That was 10 years ago, more than 15 years ago. And then we see this geographically, we see this regionally, that poor neighborhoods, that like literally the physical environment of a neighborhood where there's access to care organizations is related to family stress. And so there is really good now strong evidence that patterns of neurological development are not genetic, which is what we always thought they were, but rather a function of environments and investments. That's where the neurological development is coming from. It's coming from this, where you live and how you live and what access you have. The second source of disparity is these institutional responses, the ways that our institutions respond differentially to different young people based on who they are or where they live or what they look like. So we see this in all the systems. And we point specifically, this is an area where I mean, I'm not supposed to talk about all the, we're supposed to only have one story, right? But like, I'll just tell you the truth, which is that, don't record me, but this was an area where we had a lot of debate about like what's going too far in terms of what the state of the evidence is, because the economists don't necessarily see the same thing that the education researchers see in terms of what the state of the evidence is and what the quality of the data are behind it. Don't even get me started with the word quality, but anyway, you know what I mean. What do we count as evidence? But school segregation and school financing in the education realm, accessing quality in the healthcare realm, just taking the juvenile in justice system, we've seen declines in the last 25 years, actually 30 years now, in things like arrests and detention. But as the numbers have declined, the disparities have gotten bigger. So what's happening is we're trading out who is involved in those systems, meaning the child welfare and the juvenile injustice system. And then finally, the third is that prejudicial and discriminatory attitudes and behaviors by adults or peers are what shape the lives of young people. And I just love that the National Academy says this. Everybody say the National Academy said so. And we specifically call out racism, bias, and discrimination by teachers, educators, healthcare professionals, child welfare system actors, juvenile justice system actors as the source of the inequality that shapes the lives of adolescents. Y'all, this is so important to me. And this is why I like the pandemic happened and we were really trying to be out there and talk about this at every conference and just to get people to, I mean, many of you, this is, I know that this is a choir. I get it. But the fact that it's here and that we should be speaking with authority now in ways that we don't need to apologize. Like we clearly have the science to support these assertions. And that we know, and I'm here with you all, so you all know about the incredible disparities, differences in opportunity that result in the disparities that we see, that LGBTQ young people, this is just one of the examples in terms of substance use or HIV, that mortality for Black youth is 50% higher than white and Latinx youth. That we see the same difference by 50% in terms of math proficiency based on something as basic as whether or not you pay for your lunch or not, right? It's not about whether you have lunch money, that you have the neural capacity for math. It's really not. It's about like what all of that means and signals. And the juvenile injustice system is the dilemmas and challenges are so profound. It's almost breathtaking to think about. You all are familiar with the ways that Black and brown youth are dramatically overrepresented in the school to prison pipeline and in the injustice and the child welfare systems. But the redemptive arc of this story is that disparities are not immutable and that adolescence is this extraordinary period of developmental promise. If we can, and we know that the brain and the people that have the brains, that young people are responsive to the changes in their underlying developmental change in their conditions. We know this. We've there have been randomized trials that actually literally change conditions that adolescents are in and show change in their cognitive functioning behavior. So what we need is sustained systemic change for all young people, in ways, in policies and programs, and trauma-informed care approach, and emerging tools. How am I doing on time? Because then, so I'm gonna shift now to really say, in the second part of the book is where we really talk about guiding principles for policy and practice. And I'm gonna sort of just really wrap it up to talk about, to really focus. And I could say more. I've spoken, I've done a lot. I've been one of the people on the committee that's spoken a lot about education. If people are interested in that, we've got, you know, important recommendations with respect to education, child welfare and justice systems. But I'll focus here on the health system in particular, and say, this is again, like, y'all, I actually cut down like 50% of the text on the slide. So just, I don't know. I could have made more slides. I'm not, and then I started thinking, like, am I supposed to get permission before? Okay, whatever. And again, I don't need, maybe I should have talked about a lot of other things, because I'm sure you all, again, I'm thinking, well, this is the choir. Y'all know that, like, access to appropriate care is what young people need to be healthy. And in particular to develop habits around healthcare, right? What we know about adolescence is that, like, all the behaviors that we start during adolescence are the ones that carry us through the rest of the entire life course. Like, so that, like, establishing a self pattern of health care is really important for, like, healthcare access and utilization throughout the rest of life. And we point out these important, big barriers to care for adolescents that we really need to work on as a cultural system. One is financial. I mean, the financial one is the profound one in the United States. And then we know that adolescents are inexperienced with navigating care. Care systems are complicated, as well. We're all, like, navigating any kind of health care system is, requires determination, if not, sophisticated education and analysis to manage it. Confidentiality emerges across so many literatures as, like, a critical issue for young people. This is, here we are in Arizona. I now live I lived here for 11 years. I lived in Tucson for 11 years. I live in Texas now. This whole issue of self-determination and the whole movement that undermines that, we could talk about later. But the other thing we know about this period, about sensation seeking, novelty, engagement, think of it as, enthusiasm for learning, are also the things that make people more vulnerable than any other period of their life for just the physical morbidity. So these are things that we need to think about and worry about. And so I'll just cut to the chase to the recommendations, and then I'm glad to have conversation about any or all or other things. These are the 5 recommendations we make in healthcare, and I do encourage you to, read it. And this came out, think about 2019 in the summer, right when this was coming out, and think about 2017 when we were planning the book, and our imagination of the policy context, the federal policy context that we might be speaking to. So this first recommendation to the financing of healthcare services for adolescents, I mean, it's basically, I think everybody here knows it's broken, but, insurance coverage for un or underinsured. And we specifically call out changes in Medicaid to increase access for adolescent health, expand Medicaid in states that haven't done so, and deal with Medicaid reimbursement for pediatric care and make it at least equivalent to Medicare reimbursements for care, for example. So some really granular, we get to the really granular, like, what should the nation do? The second is improving access to comprehensive, integrated, coordinated care. And here the big issue is confidentiality for adolescent health and adolescent care and service care. And that is so complicated. And it's one of the areas where we know it's so policy context dependent. And this is an area where it really matters where you live. And it matters who your provider is, but it matters what state you live in terms of your rights to confidential supportive care. The third one, this was before COVID, that we were talking about increasing behavioral health and treatments care services. And it's hard to imagine, how much we've learned about how deeply under-resourced and ill-prepared we have been as a nation for the adolescent, the global, the human mental and behavioral health needs, but particularly adolescent health ones. So we specifically call on things like CHER's behavioral health workforce training programs, the National Service Corps, the National Health Service Corps, specifically calling for investments in those programs that are preparing behavioral and behavioral health and treatment providers in the nation, improving training and distribution in a number of adolescent healthcare providers, a bunch of recommendations for, the numbers of pediatric with adolescent focused pediatric medical training programs is an outrage if you think about the fact that, I didn't say this earlier, but 24% of the country are adolescents. And we don't have a medical system that is prepared. We're so out of balance when we think about sort of the medical and health needs for young people. And then finally, and importantly, for many people in this room who are doing the science, improving federal and state collection on adolescent health and well-being for the possibility to do a better job about understanding and tracking adolescent health and well-being. I mean, one of the things we get into the weeds about in the report is our strange culture of data systems, the explosion and possibility of new data analytics and data sciences that have been brought to bear for all kinds of wonderful new tech and consumer possibilities, but are way behind when it comes to our ability to really deeply understand. We also wrote this report at a time when we were also had growing concerns about safety, protection, and vulnerability around adolescent information. And so this is a whole area, I think. So data science, I hope there's some young future data scientists, adolescent data scientists in the room, because it's a whole area where we need an explosion in access and use that is combined with a deep, new, radical approach to ethics in the data that exist and are out there about the lives of young people. So here's the link to go straight to the report if you want to download it. And I'm glad to talk about this or other things. And thanks for your time today. Time check. I don't even know what time it is. Are we good? It was 10. Okay, great. I'm glad to have discussion or. We always say questions, but you can just have a reaction too if you want.
And yeah, it works through the mask. Okay. Do you have thoughts about autonomy for youth to participate in research? In particular, I'm referring to older adolescents and IRB protocols that might imply that we really need to have parental permission, but yet there are movements in adolescent health to really look at the seeking of health services without parental permission. So I'm curious to know if you have any thoughts about that.
Oh yeah, I have a lot of thoughts about that. And actually there's a really important, this is an area where our institute, where we as, I'm calling out myself in all this, but we as scientists have let our institutional legal liability concerns, we have let that dominate in the conversations about human subject protection. We have a terrible, terrible, terrible history about taking advantage of people in research. So we have to have human subject protection. So that's not what I'm saying, but happens. There's a really great resource, the Society for Research and Child Development. It's now been about 4 or 5 years ago. I happened to be on that too, which was nice. To be on the federal government revised the Common Rule, which governs the protection of human subjects in research. And the Society for Research and Child Development got very involved in the proposed changes to the Common Rule. And then there's a great report. It's like a social policy report on the changes to the Common Rule. We have so our institutions so misinterpret the Common Rule and what the Common Rule says for research on vulnerable populations, which is lots of people, not just minors, but we treat minors differently than we do many groups. There's some other groups that we fetishize too. There's minors we fetishize and we worry about, prisoners. There are other groups that we treat quite differently, and we hold to a different standard that is not consistent with the Common Rule. But the Common Rule says if it's not more, I'm going to not get, I used to be able to recite it. If it's not more invasive than a routine medical exam or educational exam, it is exempt from, the research should be considered exempt, which just is like cuckoo banana when you think about the rigmarole that adolescent health researchers have to go through. And I'm absolutely sure that no survey study or interview or focus group I've ever done was more invasive than a medical exam for a 13-year-old or a 16-year-old or 18-year-old, right? So, for example, and in fact, it's completely consistent with the Common Rule's definition of like typical educational exam. I mean, that's kind of what a survey is like, right? So so check out the Society for Research and Child Development. And I think one of the things we need to do more, and that is one of the reasons that is important, I think, is because it's a place to cite a scientific society that is actually, that are the experts on the ethics of research with children. I mean, I'm not talking about how to get around, the Common Rule, but I mean, we specifically talk about the ethics. There's really good developmental cognitive science about real age graded, about like how young people understand their participation. So the other caveat I would say is that, we have this age 18 thing. There's also an age 13, 14 thing that's pretty clear from the sort of cognitive science in adolescent consent that is a sensitive change, and that starting at about age 13 or 14, young people have young adolescents have the same understanding that adults have about consent for participation, about their information for other people. And that before that, there is some nuance about how young people understand what that actually means, 12, 11, 10. And so one thing is to then, educate ourselves and be clear about, but you asked about older. So anyway, so I think this is an area where we need to be more assertive, and we need to get on the human subjects review panel so that we can educate them. And that's another whole thing, like selfless act on the behalf of the community of scientists. But it's really important, because I think that there's been I've been at multiple institutions now in my career, and there's the culture of the institution really shapes what research is possible there. Not to mention the legal policy climate. So, I have been gone for I left University of Arizona 7 years ago. So I'm not exactly sure what the policy climate, the legal policy climate, the legislative climate, but with respect to adolescent self-determination. But, when the Parents Bill of Rights was passed in Arizona, it really, some of you who were doing adolescent research before and after that, it shifted in some really significant ways. I would say what the science tells us is that it's inconsistent with our understanding of the adolescent's cognitive developmental capacity for self-determination. So we need to think hard about that.
Thank you.
That was really long-winded, sorry.
Thank you for that. My question to you is given the timing of the report release and the pandemic and all of that, have you seen has the federal or states implemented any of your recommendations? And could you talk about that?
That's I was texting the Emily Backus, who was the director of the National Academy's director of the report at the time. I do not have a good answer to that. I wish I had a good answer to that. I'll find out and I'll circle back to you. In terms of what I do know is that there was a lot of enthusiasm about the report. I mean, one of the interesting things about this report is, I don't know if the list of funders is still on here, but we had some really interesting, and the funders were also very motivated in getting the word out about this report. And it was, at least last year, it was the most downloaded National Academies report from their website, it was like tens of thousands of downloads, which is a lot for a scientific report and something like the National Academies. And I promise it wasn't just me and my students, like, keep downloading, keep downloading. But that was really, really, really encouraging. So this is totally fair. I should find out like what the, we have been, of course, wildly distracted. So, and I know that the funders network for adolescent research translation, or that group, has been very invested in some key policy advocacy stuff, but I'll find out. I should know that. Any other reactions? Or I can pose the question, which is like, how does some of this land? How much of this is, I mean, I still feel like I feel like the, neurobiology is still, I feel like there's still such a gap between, my new appreciation and understanding of the adolescent neurobiology and sort of the culture, the public understanding of that. And so I'm one of the things we're interested in is like, how do we, the promise emerged in our conversations when we were talking about what do we name this report? How do we compare, how do we top neurons to neighborhoods? That was so alliterative and stuck for people. But we really settled on the promise, because that we've really felt like that is the rhetorical move that we need, and the legal policy cultural move we need to make as a nation. But I'm interested in how that works. And we also had great support from Frameworks, which is a great group that really thinks about how to frame ideas for public consumption.
You hinted at the education side of things, that there are some recommendations there. Can you give us the maybe elevator speech part of or summary of that?
Yeah, I might be able to do better even. Let me see if I've got the slides at the bottom of my. Look at these slides, y'all. Can you believe that? Look at that. It's silly. Okay. Oh shoot, where am I? It's gonna give me every single darn one. Well, I'll show these as they are, and then we can. We talked about school funding. Talked about, and in particular, state tax structures around school funding. Look at that. Talked about educational pathways. Trying to, one of the conversations we had a lot, Nancy Hill at Harvard and Joanna Williams, who was at Virginia at the time and is now at Rutgers, really helped us think about undoing not thinking about education as schools. I mean, thinking about education as blowing up, just only thinking about education as schools, and really understanding needs for pathways, and the dilemmas of how do we think about the old language of vocational education in ways that don't perpetuate the ways that worked 50 years ago, but calling on the dramatic need and potential of that for young people. That was the next one, essentially. There's a lot on sleep just because of some of the personalities in the room, but we talked about like sort of how to think about, I don't know, sleep and schooling. And then a lot about sort of how educational environments can foster inclusion and equity and can work against many of the cultural forces that stabilize inequity. So frankly, one of the things in my field I know later we're going to be talking about LGBTQ youth and health. One of the things that's really important and has been meaningful about this report is that it's the first time the National Academy has called out what the science says about creating safe and supportive schools for kids who are at the margins, the policies, practices, and programs that make a difference for that. So that, I think that's the last of the, help adolescents and families navigate the education sector. So thanks. Yeah, thanks for asking. That was my quick one, but yeah.
How to include is there any discussion on how to include parents and educate them as well, since it's a whole 20 years ago,
Yes.
parenting was much different?
Yes, and that was, family was not one of the domains we spoke about because we had lots of conversation about, and I think I don't know if you'll see it or not. I hope you would see that we have spoken about the role of families, parents, caregivers throughout, like in an integrated way, and about the engagement of parents in each one of these systems and the engagement of parents in the adolescent developmental domain. So that was our, the move we took was, and I hope it's successful. I'm trying to think back now. It has been almost 3 years that we've finalized it, but we really were thinking about integrating the role of families throughout, both in the developmental domain and in the institutional domain, rather than calling out parents. Because what we ultimately felt is that it is a domain over which we have very little governmental, and rightfully, and I think sort of culturally, we pretty much all feel that it's not an area where we would have direct policy intervention. So anyway, that was the approach that we took to it. But it's a great question. And I'll have to think about it myself, but maybe if you download the book, or if you've already read the book, you can let me know how that worked, because we talked about that a lot. There was an earlier version. There was a version where we thought, do we need to have a chapter, on families? But then we thought, this is really, it turned into like, are we trying to educate parents about, about adolescent development? Are we trying to tell parents, kind of like make recommendations to parents? And it felt like that wasn't the goal of this project as it came out. But it's a great question. Yeah.
Ideas about what people could do, researchers, I don't know, policymakers, how they could improve data collection for adolescent youth, especially like LGBTQ youth. Like, it's very, like, there are definitely state laws, that don't collect sexual orientation data, and it can really limit the actual evidence that we have. And I know that different states have different politics and agendas and things like that, but there's got to be a way, I feel like, to be able to start collecting data that can, better improve, especially for LGBTQ populations.
Yeah. That's a really big question. I think there are lots of levels from the, micro, like how are you designing your study, and how are you working with your IRB in your community, to the structural, like what's happening at the federal government with respect to measurement and the questions that we ask in the populations that we study. And so, I think part of it is like, keep talking about it. A little thing that does, a little tiny soapbox, is that there is a big science on health equity and data collection for health equity. And one of the propensities you see in bringing together people like from Department of, I've been in, there was an effort a couple of years ago to have a national plan for adolescent health. And I was in a room with representatives from like Department of Labor and Department of Education and Department of Health. And they don't talk to each other, and they all think differently about, like, they all have different standardizations for their measures. And some of them don't think it's even, people are like, oh, well, we would need to study how to measure that. I'm like, stop that. That is silly. We have measures. They may not be the best measures. We know that there's all kinds of problems with measures. And the thing I would always point to, like, we know that we have a fundamentally broken way to measure race and ethnicity in this culture. Like, it's, if you try to survey adolescents, they're like, what? You're like, the federal government asked it this way. We have to ask you this way. Would you be willing to identify yourself in any one of these ways? Could you just do it for us because it's the framework that we have to do because we're funded by the National Institute of Health? We actually trained our interviewers to, like, help young people understand what it meant to be, like, Hispanic Latino. They're like, no, I'm Mexicano. It's like, okay, well, would you mind being Hispanic Latino for the case? Would you mind? So, like, I'm like, we already know it's broken, but we still do it. Like, there is a fetish around sexual orientation, sexual gender minority research, and we need to just stop that. And some data is better than no data, And so, and the other thing is that we have a track record now. We had a period. We have now integrated, we've made big strides in many of the federal data systems for adolescent health in Division of Adolescent and School Health, in Department of Education. We've made real advances. And so one of the concerns now is that we don't backtrack and that we call it out when it happens. And then the other thing, and this is, it's because it's not me that you're citing, it's not self-serving, like, cite use the report. I mean, use reports like this from the National Academies, use workshop. There was a new workshop, and I should put it on here. We did a workshop, we released a workshop report in January on reducing inequalities for LGBTQ youth. It's about what we can do to actually not just, it's not a report on disparities for LGBTQ youth, because frankly, we already know that. It's a report on what we could do to reduce inequalities for LGBTQ youth. So, like, find those things and cite them so that your IRB knows that there is authority and science behind what we do. Communicate. We have to keep educating our Congress critters and policy persons that maybe don't fully understand the science. So I think there's a lot of, there are a lot of individual things, but then there's, then get involved and advocate and say no when people try to remove the sexual orientation items from the YRBS or whatever. But there's anyway, if you think about, how far we've come, it's pretty amazing. And there's some great stories about how we got here from people like in this state, the way that, I can tell during the break, I'll tell you about the addition of the sexual orientation question to the YRBS if you don't know about it. It's a great story. So thanks.
Thanks. We appreciated your presentation so much. And we now have another session, but we thought we might take just a bit of a break, let people kind of get up and move around, and just take about a 5-minute break, no more than 10 minutes for sure. And we'll be right back. Thank you.
Quick reminder, I'm Amanda Pollitt. I'm an assistant professor in the Department of Health Sciences here at Northern Arizona University. I'm also affiliated with the Center for Health Equity Research, specifically through the Southwest Health Equity Research Collaborative. So I'm going to present some of our research on transgender youth health and well-being. I want to talk about supportive policies for the health of transgender youth. I planned for this to be a relatively quick presentation. I'm hoping to give you some context, some sort of research evidence that we've done. This is actually work that I have done with Stephen. And then what I really want to do is have a sort of broader conversation about policies for transgender youth, for sexual and gender minority youth more broadly. So this is sort of, I'm presenting this research more as a starting place, especially, following Stephen's talk, thinking about a lot of the things that he talked about in terms of policies and practices that we can implement to support youth. So I'm not sure how much this audience knows about transgender and gender diverse youth. So some background, the transgender youth are youth whose gender identity does not align with their sex assigned at birth. So this includes transgender girls, transgender boys, and non-binary transgender youth and other gender diverse youth. So these are youth who might identify as neither male or female or both male or female, some combination, something like that. About 2% of high school aged youth in the United States identify as transgender. And studies have consistently shown that transgender youth are at high risk for poor mental health outcomes, including depression and suicide. And one recent study from the CDC showed that about 35% of transgender and gender diverse youth reported suicidal behavior. So that's not even including self-harm, depressive symptoms, and other kinds of mental health outcomes. So understanding the policies and practices that can be used to support transgender youth is critical for improving mental health, reducing health disparities, and preventing suicide. So our research on chosen name use is about how many given names are gendered. So choosing a name that better aligns with a person's gender identity and gender presentation can be an important part of the gender affirmation process. So, having our identities acknowledged and respected is important for the mental health of all people, but especially for adolescents, because this is a time period when identity development is happening. Youth are really developing who they are and how they want to identify during this time. So today I'm going to talk about the research that we've done examining how chosen name use benefits mental health of transgender youth, and then we're going to talk about how related policies can be used to support transgender youth. And so these are the bottom in the very tiny text, I'm sorry. Those are the two papers I'll be talking about. And I can provide more information about those, give you access to those. So the data we used came from this 4-wave longitudinal study of lesbian, gay, bisexual, transgender, and queer youth who are 15 to 21 years old. These data were collected in 2012, starting in 2012. So keep in mind the sort of political and social context that was happening around that time. These data were collected pre-marriage equality. We collected data from youth in 3 cities in the United States, in the Northeast, Southwest, and West. We say this because we won't name the cities, but I will point out that the data from the Southwest did come from Arizona, which is important, of course, I think for, in talking about and being a part of CHER, being a part of CHER, and understanding disparities in the Southwest. We had data from 129 transgender youth. 74 of them had a name different than their name given at birth, and the rest did not. So the mean age of the sample was about 19. Our sample was racially and ethnically diverse. And we asked youth, were they able to go by their preferred name in 4 different contexts, where they could use their name at home, at school, at work, or with friends. Some information about the measures: we measured depression, we measured suicidal ideation, and we measured self-esteem. Importantly, we had a measure of positive suicidal ideation, which the language of that is interesting. It's more about, sort of the antithesis of suicidal ideation. It's why I feel like my life is worth living. I feel like I have worth, versus negative suicidal ideation, which is your more typical suicidal ideation about, wanting to die, those kinds of questions. And if you have more questions about the measures or anything, I'm happy to talk about it, but I don't want to emphasize it too much. So we conducted some bivariate associations comparing between those with and without a chosen name on different outcomes, on namely to understand whether or not there were mental health differences between these two groups. And then we also conducted linear and Poisson regression to see how chosen name use in each of these contexts or altogether predict mental health. So we found there were a few differences between those with and without a chosen name. So this figure shows where there were statistically significant differences. So in positive suicidal ideation, those with a chosen name had higher positive suicidal ideation. Those with a chosen name also were more likely to report higher binary gender expression, which is not necessarily surprising, especially if that is different from their sex assigned at birth. Having a different name is probably more aligning with how they're presenting their gender. And then those without a chosen name reported higher parental support. But we didn't find any differences in terms of other mental health outcomes, including depressive symptoms, negative suicidal ideation, and self-esteem. We found that most youth could use their name in all contexts, which is very encouraging. So the majority of youth could use it in all 4 contexts that we measured. And breaking that down a little bit, we found that most youth could use their name with their friends, probably not very surprising, but they were less so able to use their names at home and at work. And we found that, importantly, parental support predicted whether youth could use their name at home. We also found that being out to teachers, but not to classmates, was associated with chosen name use at school. So we sort of speculated that might be that youth are telling their teachers, hey, I have this name that's different than the name that's on the school roster or in the files. Please refer to me by that name so then that I'm not outed to my classmates. And we found that using a chosen name in more contexts was associated with better mental health. So for severe depression, for suicidal ideation and suicidal behavior, when youth could use their name in all 4 contexts, that's when we saw the biggest reductions in poor mental health. So we didn't find differences in mental health outcomes between transgender youth with and without a chosen name, suggesting that choosing a new name is not necessary for improved mental health among all youth. So there are many reasons why youth don't change their names, and this decision should be respected just as much as choosing a new name. So youth shouldn't be pressured to change their names just because they're transitioning. And we found that youth were less likely to use their chosen name at home or at work, suggesting that there are social and legal constraints on chosen name use, such as family rejection, or policies that require the use of legal names in the workplace. So this is why it's important for institutions such as schools, community organizations, workplaces, adjust their regulations and their information systems, their policies to include youth's chosen names, especially because when youth are minors, it's much more difficult to change their legal name compared to using a chosen name socially. And so this is especially important for transgender youth with a chosen name because being able to use their name in as many contexts as possible is critical for better mental health. So questions about anything that I've presented so far?
About why you think those differences occurred?
Yeah, so my guess would be that youth are aware of the environments that they're in, whether they're rejecting, whether they're accepting. So it's likely that they have an awareness of whether or not their parents would be supportive of their use of a name. And so youth who have a chosen name, they might not feel comfortable telling their parents, asking their parents. It's also one of the things that we've been talking about, parents often spend at least 9 months picking a name for their child, right? When they're pregnant, and that name can carry a lot of meaning. So even for really supportive parents, it can be difficult to make that transition to a different name. And so that might play a role as well. But But again, it's really important for health. So ultimately, hopefully parents, use the name of their youth that their youth prefers. Yeah. Other questions? Oh. Yeah, the question was about parental support. Explaining that finding a little bit more. Other questions? Okay. So I want to spend some time with a discussion. I'm hoping this will be pretty interactive. I really want to have a conversation with everyone in the room about policies, about practices, what we can do to support youth. Stephen is my other panelist. Yeah, please. Yeah, I'll move it. And I can pull it back up. I did try to get other panelists, but it was very difficult. So I hope that all of you will serve as panelists for this. But to give a bit more context about what I'm hoping to talk about. So in 2022 alone, the United States has passed a record for the number of anti-LGBTQ+ bills that have been introduced in state legislatures. There have been over 200 bills introduced. In Arizona, there have been at least 13. 3 of those have passed. 2 of them are targeted at transgender youth. So the first is restricting specifically transgender girls from participating in sports that align with their gender identity. And the other is restricting access to gender affirming surgeries for youth under 18. So these bills have been really targeted. And thinking about some of the things that have come up in Stephen's talk, I'll show you. So these recommendations for policies and practices come from a recent Society for Research on Child Development report. So I just pulled them, and in thinking about different domains, the first in healthcare, don't ban or penalize the use of developmentally appropriate gender affirming healthcare, including surgeries that are medically necessary. Much of the conversation is around these decisions should be made between medical providers, between parents, between children and adolescents. Insurance coverage, of course, should also be required of these different procedures. In Arizona, it's specifically, the bill is about surgeries, but we can talk more about in other states how these bills have been banning all gender affirming care. And then in terms of schools, adding gender identity and expression to state and federal anti-bullying and non-discrimination policies as protected statuses. Sexual orientation as well, right? We know that enumerated policies, so policies that specifically protect sexual identity and gender identity in terms of anti-discrimination, these policies are more protective for health. They're more protective against bullying and bias-based bullying than general bullying policies that schools have. Of course, training school personnel on topics for affirming gender identity and expression, using youth chosen names, using their pronouns. I feel bad I pulled you up here and I'm still talking. Okay. And Steve and I have been talking a little bit about how to frame these particular policies. So allowing students to engage in activities and sports that align with their affirmed gender. One of the things we were talking about yesterday, in terms of sports and physical education, we know that transgender youth are less likely to be involved in physical education in the first place. And so restricting their access to physical education is then contributing to these other kinds of physical health disparities that we see. Same, of course, just allow people to use the bathrooms and locker rooms and things they feel most comfortable in. This should be obvious. And hopefully to this room, it is obvious. And then we were talking about data collection, standardizing the collection and privacy of gender identity and expression data in medical records. Some of the bills that have been introduced or passed in different states has been restricting confidentiality of youth. So not allowing doctors to keep medical records confidential, not allowing youth to keep those records confidential from their parents, for example, which can out youth and be harmful. And then mandating the collection of gender identity and expression data in state and national school-based surveys generally. Oklahoma just passed a law not allowing statewide surveys to ask about gender identity. They can only ask male or female, which of course just restricts what we know about people and about their health, and we'll spend a lot of time talking about that, I think. Okay, that's what I have for policy. My panelists.
There she goes. So shall we have conversation or questions or reactions?
I would like kind of thought that I actually.
The mic is coming.
So like, there's been a lot of discussion about transgender participation in sports. And there's been like a lot of fear in my mind. I think preventing transgender people from participating in sports is kind of a slippery slope, because then it leads to more monitoring of athletes in certain ways. Like we know in the Olympics, there that track athlete who had high testosterone levels that were abnormal for someone who they considered female, and she was barred from participating. It kind of leads to a slippery slope. And we also know that there are multiple combinations of profiles of chromosomes and hormonal levels that can be assigned female or assigned male, depending on those profiles. How would you suggest like dealing with a lot of that fear, or like educating around that? Because I think that there's a lot of, I think that there is a lot of fear in certain circles that, like, I don't know, that if a transgender person is going to go into a female bathroom and to be nefarious, and I'm pretty sure that, you know, that's not, I don't think that I just kind of have a feeling a straight male maybe would have a problem dressing up as a woman to go in and rape a woman. You know what I mean? Like all of these things are kind of interconnected. So I'm just curious, how do you talk about that? How do you how do you educate people, or at least like bring the conversation back to something that's real, I guess? That's kind of my question.
Well, for me right now, academically, I think the literature, thinking, writing on moral panics is helpful, especially sexual panics, because I think one of the things that's so upsetting about this move against trans, really children, I mean, it's really clearly targeting trans kids, is that the rhetoric of the sort of the archetype of the issue is actually a non-issue. I mean, we can point to a case of a cisgender girl losing a scholarship to a transgender girl, I guess. Supposedly there's a case that happened. But like, participation in sports is a completely adolescent typical experience that we know is related to physical health and activity and well-being. It's like, it's just and it's a normative part of adolescent culture, youth culture, school culture, community culture. So the issue is a non-issue for the most part. I mean, when we get into specialized sports, I guess we have a different conversation. But again, like, this is like, really, where's the problem? Same is true with respect to gender affirmation in healthcare. I think people's mind goes to like sex change or, hormone treatments. And the reality for so many families, and this is as you know, probably is a big, could become a very pressing issue right now in Texas. They're really, I've never met a family with a transgender kid that was like, oh, cool, let's get you some hormones now. Like families struggle. Families deeply discern how to support their children. That's what parents do for the most part. I mean, that's like actually evolutionarily adaptive. That's like what we do as humans. And so, and the need for medical intervention is a very minor part of the bigger picture of what families, parents in particular, but families and schools and healthcare providers and everyone need to support gender affirmation. For frankly, all of us, part of it is that we all need gender affirmation. Everybody needs gender affirmation. You need and the idea that everyone will either be Marilyn Monroe or Arnold Schwarzenegger is false. We all know that to be false. So we need gender affirmation for a huge spectrum. And so little of that is actually about medical treatment and intervention. And when it is, we really, really, really must leave it to the professionals who actually have standards of care and practice and deep medical knowledge and science. So that's what is so I do think this is why I turn to the literature on panics, because these panics have been constructed around issues really that are, well, it's anyway. Yeah, I mean, there are for the vast majority of families who are trying to figure out how to support their kids, they're not really that worried about hormones right now. I mean, some are. There are some, but most of this happens earlier in childhood. Most families start to do gender affirmation in lots of ways that don't have to do with medical intervention. So this calls out and create. The other thing, I've done some other work that shows the ways that these sort of panics get into the culture of childhood and lead to bullying and social exclusion. And I'm really worried about sort of the invitation and permission for stigma and discrimination around gender expression. So anyway, that's my long-winded. These are non-issues. So to try to help people realize kids just want to play ball. Some don't, a lot do. And we should just be encouraging anybody that does to do it because we know it's good for them. Kids just want to be able to, not everybody wants to fit in one box or the other. And we got to figure out how to, and we know that supporting them to be in a box or one box or the other in between, we know that support is crucial for their mental health. We know it. So enough already. So anyway.
Yeah, and to your other point about how do we sort of educate policymakers, one part that's so problematic about these bills is that they use research and really they misattribute research. They sort of select research in ways that is clearly biased towards their arguments rather than what the consensus actually is and the evidence. Even looking in some of the Arizona bills where there's this sort of cherry picking about biological sex, the whole gender affirming surgery bill is like, no, except when it has something to do with if somebody is intersex or, so there are exceptions. So they understand that biological sex is more complicated. That is in the bill itself. At the same time, they're like, so the contradictory nature of that. So there is, there's a recent sort of, I don't know if you call it a rebuttal, but it's sort of a deconstruction of the evidence that has been used in these bills from a group that came out of Yale, I think. Did you see this?
Is it the American Academy of Pediatrics statement? Or
no, this is really recent. Okay. I'll find it and send it around, but they point by point break down, their misunderstanding is probably a generous term, misunderstanding of the literature to show how this is not what the research actually shows about how we understand sex, gender identity, gender development. So those kinds of reports are going to be really important too for educating people generally, policymakers. Oh.
I got you, so you don't have to turn around. We have an online question from Michael. Thanks so much for sharing this great research, Amanda. Really helps to center this conversation. thinking about Stephen's earlier presentation, has there been much movement to address the myths about transgender youth that are at the heart of the anti-trans policies and state bills? Seems that there is a lack of understanding and knowledge driving these decisions.
Yeah, I mean, I think that there are groups and, you know, that I can think of a couple groups that are trying to, you know, be proactive about asserting a sort of typical child developmental perspective on transgender youth. There's a group called True Child that is kind of, it's really, to me, it's really interesting because it's kind of like using frankly youth and social media approaches to identify young people who are trans and gender diverse as influencers, and sort of create a cohort of young people who can just be and sort of be, frankly, become visible, culturally visible, and just express the diversity of the genders that they express as a group of young people. So there are groups that are trying, you know, this group is funded out of a group based in California, but they're bringing together kids from around the country to really think about how do we just tell our stories, just, you know, show what it means every day to be a trans girl, which is like, I just get up and brush my teeth and go to school. That's like what I do. It's not, that's all I do. You know, like, and I like to play with other, like, you know, my friends, we like the same things and we like to do the same things together. And that's what and it's kind of like just, oh yeah, that's what it means to be a kid. So I think there's some groups that are trying to do that, but it's a great, you know, I think the question becomes, how do we normalize diversity? You know, how do we normalize the, you know, sexual, gender, race, cultural, ethnic diversities in our communities in ways that are like, it's actually kind of boring. It's just like different, you know, it's like, so I don't know if that's a good answer. Do you know of other efforts to?
I'm not aware of time, and I think that might be an important place for intervention, like societal intervention, is to do more of that kind of work to normalize people's experiences. And I think, you know, some of that maybe on social media, things like that is happening, you know, where you hear stories about kids who are just like, oh, that's just, you know, Susie or whatever, you know, like the kids just have this sort of acceptance that I think is actually more complicated in reality, but those stories I think can go a long way, just leveraging that kind of thing to sort of,
The Human Rights Campaign also has a parents council that is a group of parents of sexual minority and gender minority kids, some of whom are people that are famous, that probably everybody's heard of, Judy Shepard, Matthew Shepard's mother, but and her husband, and several other parents of folks who are known in the media, or and that's a group that's trying to, they have I think they're developing a social and media campaign around just talking from the perspective of parents. I think that's one of the things that's so like, no, I know some of the gender affirming clinician care providers in Texas that work with children and families. And I think one of the things that's been so profoundly upsetting is just that so many families, it's really that families are just really trying to figure out the best thing for their kids and how to support their kids. And to be told that it's such an ironic move from folks on the one hand that say that parents' rights are so important, to then say on the other hand, the best practice and the best medical care that has been recommended for you to support your kid is actually abuse. You know, so profoundly mean or wrong.
So I work with a school who their policy is that you can only use a child's chosen name if you have parents' permission. So I don't know how that aligns legally in Arizona. But what do you recommend for educators who want to be gender affirming in the classroom, but their school policies kind of go against that?
I have an opinion.
Well, it's just really interesting because so one of the valences of this issue is the way that we're now sort of codifying difference. The reality is that so many people live in the world with a name that is not their legal name. I mean, it's so great. I mean, so much, like we call them nicknames. And people use all kinds of names that are not literally what is on their, record. And we, like, guess what? It's a thing that humans do. We learn about each other and we adapt to one another's, and we respect one another's names and identities. And so it's real, at some level, this is what you're pointing out is the way that we're constructing the problem, because the kid who goes by Tom, but their first name is William, but their middle name is Thomas, and they go by Tom, and it says William on the roll. But guess what? You learn after about a couple of days that it's not William, it's Tom, or whatever. That's one Anglo version. But so the recommendation is, probably to say, like, in what ways are we already outside of the bounds of that? Maybe pointing that out is not strategic. I don't know. But like, I think that it is important, the message for, the folks who are entrusted with the well-being of our kids, which is our, teachers and our ministers and our faith leaders and everyone, is that, like, seeing people, respecting people for whom they are is really what they need. So like, how do we just help a school understand, that's complicated, and it's fine if we're not going to like change, if we have some new rule, but how do we just in the everyday of a class let people express themselves as they want to express themselves? I mean, people call me Steve all the time. I've never in my life gone by Steve. I go by Steven. Like, okay, is that against the rules? Do I need to like pull out the rule book and say, I am Steven? Anyway, I'm not providing a good answer. Besides, like, you can become the voice of like, what the science really says, that we need to support and affirm, kids' names. And it is true that changes and develops, and probably lots of us have had kids that have gone through periods where they want to have a different name. I mean, part of it is it like even forbids that kind of thing. Like, you can only be this one thing I mean, how many of us ourselves decided one year in 7th grade that we were going to go by a different name? Like, lots of us did that. I mean, it's kind of a typical adolescent developmental thing. So
What sort of complicates that, of course, is that, if it's a child who goes by Tom versus William, or, to use that example, with trans youth, it could be outing. If, a young person is presenting their gender a certain way and their roster has a name that's very, very gendered, just having to say in the midst of an entire classroom to a teacher, I actually go by this other name that is also very gendered, be like, oh, by the way, I'm trans. Like, that's, a moment where that outing can happen. So what's difficult about your question, why your question is so important, is that, how do you do that sort of preemptively so that you can protect the youth from being outed? And that's what's so hard about that policy in particular. So again, I don't have a good answer, but
I mean, yeah, so part of it is adolescence is a period of identity exploration. That's just end of story. I mean, so we have to figure out ways to, that the institutions, and particularly schools, like, it's really important that we figure out how to have records that, are meaningful, but then also how to like support the everyday. So maybe there are ways to like help folks separate we don't need to change the record, but we can, in the everyday, we can just operate in the ways everybody could have a different name. Or
just going back to what you were saying about like how a lot of times when we're talking about like these issues are not actual issues, and just like non-consistent standards for what we see as issues. So like talking about like, certain public outcry about supporting trans and queer youth in gender affirming medical care. And the point of some people being or using the reasoning that it's about protecting youth, when really we can see that, according to literature, like protecting youth would be supporting them and supporting, relevant healthcare. My question is, have you found any effective strategies or anything about having conversations with people when they say that their issues with something are about a certain thing, about, quote unquote, protecting youth, when really we can see, like, when it comes down to it, it's about like control and what they want to happen, because if we look at scientific literature that you've put out, or that, scientists have put out, what is most beneficial for youth is certain things, generally not like limiting policies. Or even, when you're talking about names, how it's already a normalized thing for people to go by other names, or even changing names when folks get married. So it's a totally normalized thing. But then when it's applied in the context of like trans and queer youth, then it becomes a problem. And people use, I guess, use reasons that aren't actually the reasons of why they're against it. So yeah, the question is just, do you have any tools or anything that has been effective in trying to untangle those things and come to any sort of like reasoning or better logic with folks like that?
Well, there's a group called Frameworks. So the National Center for the Developing Adolescents has partnered with Frameworks and released what do we call it? A talking guide around the anti-trans laws. This is specific to the anti-trans issue that is based on their research on how people, on the frames and the words and the frames that shape the way people understand the conversation. So it's a useful resource that's kind of specific in that area. But there's a lot that the Frameworks folks and folks that in the field of communications point out that the way that the language we use really does trigger different kinds of conceptual frameworks and for understanding, and that the same people can have a different take on the same issue if framed in a new way. And so so then I'll go back to the adolescent developmental part. And I think that this is a big cultural, this is a long-standing issue in the United States, the culture of the United States around control and adolescence, and how to help folks from a sympathetic, empathetic perspective understand that like control is really like not a good strategy. Like it's in fact the losing strategy with adolescents. And so like there's a small subgroup of adolescents for whom control it works as an adaptive, but it's not a typical group. The majority of adolescents, actually, it is about exploration. It is about learning who you are, and that requires stepping outside the bounds of what has been typical and normal for your everyday experience. That's literally what is required in adolescence. You've got to do stuff that's different than the stuff that was handed to you or that's right in front of you. It's what the development is about. And so helping really well-meaning people that care about their kids and feel like that their strategy's got to be to protect and control them, to understand that that's, to help them supportively understand that is actually boxing them in a way that's counterproductive, and that what they need is to have that be opened up and to have safe ways to explore and to imagine. So I don't know if that's supportive. I mean, part of it is that we get polarized and frustrated with each other, but figuring out ways to open up that conversation, that restriction, these kind of new rules that say, okay, now we can only, if we get permission to use a different, it's like those kinds of setting those kinds of restrictions are just deeply anti-developmental. So how do we help people that really do care but have a kind of a old view or sort of a patriarchal, let's just name it, heteronormative racist view, see things in a different way without maybe calling them racist patriarchs, even though maybe that's how they're acting, right? How do we help them like see the vestiges of that, and that maybe there's other way? I don't know. that's maybe Pollyanna-ish. But I do think you can reach people by talking about, adolescents need to explore. It's okay. It's actually good for them. And you've given them a great foundation. They'll be all right. It's scary, but it's going to be good.
Yeah, I think it ultimately comes back to that idea of self-determination. And one of my favorite moments of the workshop that Stephen was talking about on LGBTQ adolescents was, a scholar saying the most important thing to know about adolescents is that they're not stupid. Like, they're actually really smart. They actually know what they want for themselves. And, it doesn't mean that, they're obviously, brain development still happening and things like that. But, this idea that adolescents need to be we can trust youth to make decisions for themselves about who they are.
So I was wondering, what are some of the ways that healthcare can and have adapt and provide transgender with healthcare without insurance? Because as far as I know, there isn't healthcare out there that's specifically catered to transgender people. And so I was wondering if there was like alternative routes to providing that healthcare, because I know that there's a lot of people that are going through hormone therapy and that there are not healthcare providers to like help guide them through that process. And so I was wondering if there was anything out there that you all know about or anybody else knows about.
That's a great question. So you're talking about for like older adolescents and adults that are seeking
Yes.
medical hormone intervention.
Yeah, specifically. Or, primary care providers that help with some sort of guidance through the process. And that could be for young adults and also could be for adolescents as well.
Yeah. Well, I mean, I know that there are meaning sort of things that are beyond, that are outside the bounds of a insurance provider framework, for example. Is that what you mean? Or beyond, in some states now, beyond the provider, the guidance of what's considered legal. Yeah. Oh wait, there's
through the online sources, the credibility and
yeah.
I guess validity of the experts that are online. I don't know. I think it's ambiguous whether or not that medical care is actually any good. And so, as far as like providing support, looking into policies that would allow there to be insurance is fantastic, but right now those options aren't available. So I was wondering if there were alternative routes to that, which might be a really big question.
Yeah, it's a huge question. I mean, I think that there are standards of care that people can educate themselves about, that come from both groups like WPATH. Well, I don't even know what WPATH stands for. I mean, I'm sure I do, but anyway, from WPATH, but also like the American Academy of Pediatrics, that can provide a framework and guidance. And then I know that there's in Texas right now, there's a whole lot of referral going on based on the referral, some out of the state, but also within the state to across systems that have. There's so many different ways that the medical system, medical provider and care systems are changing their policies around gender affirming medical care and intervention. So there's a lot of that happening. And then there are a number of community-based organizations that are stepping up and trying to fill in the gaps. And so I think it's like, we have to become, sadly, some of us more than others have to become really educated consumers about our health and well-being. It is a dramatic health equity that you're pointing, inequity that you're pointing out, and we have to become educated consumers. And unfortunately, for some people, there's access is not a thing unless you can cross a state line or go to a neighboring community, or find that one physician who's going to help you. But that's, in most communities, in many communities, that, what maybe you would call an underground or, the informal networks where we, if you're in Austin, Texas, we know the people that you go to if you're in Austin, Texas, and they can hook you up with the right people. But it's finding those networks.
Like a part of it is about having the networks in place in the communities and those references to be able to know where to go.
Which there, of course, is access issues to even that, to who you know. And this isn't necessarily related just to medical care, but for example, recently, I'll show you this. And actually, Michael showed me this. So sorry guys, here in Flagstaff, there was recently a name change clinic for 12 to 24-year-olds at the East Flagstaff Community Library. Totally cool. Like this isn't about medical care, but this is sort of an informal, maybe is a interesting word to use. But this was for minors for the most part, for legally changing their name. These kinds of ways that practitioners might be able to provide care. You could have a community workshop or clinic or something that's like, okay, let's talk about how to provide this kind of care. Like, how do you administer hormones? How, what does that look like based on, level, blah, 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 whatever that might look like. There might be ways to have these sort of informal educating kinds of workshops.
So 1 in 10 in Phoenix is like, is an organization that can be a resource for 1 in 10. Yeah. Which I think was part of the group that organized that. I think. There was somebody else. Or maybe there's somebody online.
Oh, was there another question? I don't want to hog. I'm going to ask you a more boring data question. So you made mention of Oklahoma and not being able to ask about gender identity anymore. So does that apply to all national data sets as well? Meaning you would lose folks out of like YRBS and whatnot, or?
Great question.
I'm not entirely sure. I'm not sure if it's just based on state funded surveys, if it's like tied to public funds, because that's usually how these laws are implemented. It doesn't apply to federal surveys as far as I know.
I would think it doesn't. I would think that a state policy would not, that a federal project would be independent of the state, but I don't know.
And individual researchers, it doesn't apply to them either, as long as it's not from a state fund. This came up because of a project we're involved with folks at Oklahoma. We can still ask in our project and our surveys about gender identity, but it's the state surveys for that.
Thank you.
Just to wrap things up before we go to lunch, one more kind of comment and question online. I wonder if saying the child's last name and excluding the first name when calling roll might help. Then asking the child team what they prefer to be called might be helpful.
Yeah. That's a cool idea. I mean, it could, an intervention, it's an interesting strategy. An intervention could be to say, okay, then let's all agree to only use last names and see how that works. Because maybe people would tire of that and realize that that was, more annoying than it was worth, for example. I don't know. Or maybe that, that is a really interesting strategy to like say, okay, we're going to just dispense with first names and go. It sounds like old school growing up in the South when we would be just all called by our last names. But that's cool. Thanks, Amanda.
Oh.
Dr. Pollitt.
Thank you. Thanks, everybody.
Hope you had a nice lunch, had a chance to visit with everyone. And we're ready now to move into our next session. So I'm pleased to be able to introduce our next host for this panel, and that's Dr. Amanda Hunter. She's a postdoctoral fellow in the Center for Health Equity Research. And Dr. Hunter's research focuses on the impact of cultural engagement and cultural identity on mental health and behavioral health outcomes in Indigenous youth. And she'll be presenting some about her pilot study that entails developing, implementing, and evaluating culturally grounded after-school programs with Indigenous communities and organizations. So, and she will introduce her panel members when she gets up here. So let's give Amanda a nice warm welcome.
Leo Senchi Manyavu, Kechamalea. Hello, everybody. My name is Amanda Hunter, and I'm a member of the Pasquayaki tribe. I'm from Tucson, Arizona, and now a postdoc here up in Flagstaff. So thank you all for being here today, and for those of you online, I'm really excited for our panel discussion and to hear some questions and thoughts from you all as well. So first, I'll just go over my research for a little, just a few minutes, and then I'll get to the meat of this panel with my panelists. So my research has been, as Julie mentioned, has been focusing on developing, implementing, and evaluating culturally grounded after-school programs. And the program specifically that I've been developing with community was named Native Spirit. And it kind of started back in 2015. I feel like I was in the right place at the right time. There's a Boys and Girls Club kind of in rural Arizona up here in the north. And the director of that clubhouse recognized that this is a Boys and Girls Club on a tribal reservation. We should probably have a cultural program. And so the program director at that time and Tamara, one of my panelists, reached out to my mentor at the time, Dr. Nikki Tufelshoen, and asked if any master's students wanted to develop this program as their internship. And so right away I was like, oh, me, and I sent that email, like 2 minutes later. And the next thing I knew, I was driving up to Northern Arizona from Tucson, which is like a 6-hour drive, like every week for a semester. So, but I really do feel like it's been something that's been really near and dear to my heart. I will talk a little bit more about cultural identity and its impact, but as I mentioned, being the right place at the right time again is at the time that I was developing this with the community, I was having my own kind of reintroduction to cultural identity. I, as a member of the Pasquayaki tribe, didn't grow up on the reservation. I still grew up in Tucson, so the same city, but didn't have that like cultural engagement that I would have, that would have been helpful probably as a youth. And so, here I am in my mid-20s, going to like cultural ceremonies and learning from some of the elders in the community about things in our community, our history. And I just really feel like there was that piece of myself that was kind of found again and helped me get through like the beginning of grad school, which was pretty tough for me. But so it's just all kind of led to today. The program is called Native Spirit, developed first with a community here in Northern Arizona. And what we did is kind of sit down and working with the Boys and Girls Club as well, kind of try to figure out, like, we have this Boys and Girls Club format. It's the same for most of our programs. It's 10 weeks. We do like a pre and post kind of test to see how the program impacted youth. And so there's a ton of programs that the Boys and Girls Club offers that are life skills building. And so we wanted to have it fit within the Boys and Girls Club format, but we wanted it to be culturally grounded. And so we talked with some of the elders in the community, the cultural resources department, some of the parents, the Boys and Girls Club staff, about if you could pick like 10 cultural values that are representative of the community, what would they be? And then what kind of traditional activities would we do that kind of go along with that value. And so you can see the table here. We started out with 10 and have since kind of expanded to have 13. So there are 10 interchangeable sessions is what I mentioned. Some of the sessions are kind of time of the year specific for different communities. And so in some Native communities, it might not be appropriate to tell like creation stories at certain times of the year. And so, you know, in that case, we would have to fill in with one of these other sessions. And obviously, you know, we have some sessions that are planting and harvesting. So that takes place at certain times of the year. Each session is 1.5 to 2 hours. And a huge piece of this program is that each session is led by a cultural knowledge holder in the community. And so it's not, you know, me, some outsider coming in trying to teach somebody's culture, which would be strange. But so each cultural knowledge holder, elders, so you might hear me kind of use those words interchangeably. And then all of the cultural practices or activities are community specific. And so developed first with the community in Northern Arizona, and more recently for my doctoral research and postdoc research have been working with a community outside of Phoenix. And so it's a little bit of a different context, different history, different kind of social, I guess, place in time and space. And we've developed it for adolescents in grades 7 through 12, and which is, as we've heard, a huge formative part of our lives. Oh, there we go. Thank you. And so this is this is a picture from the community. It's nice. They have all over the place, just kind of like artwork or murals that kind of emphasize the importance of culture in the community. And I think that was one of my first times exploring the community. I saw that one and I had to get out of my car and snap a picture. But our kind of main hypothesis, or what I've been looking at, is trying to see if Native youth who participate in the Native Spirit program will experience more positive changes in self-esteem, resilience, and cultural identity, and then also delayed substance use or decrease in substance use compared to those who do not participate in the program. And so that's what I've been working on. And so for my pilot project that Julie mentioned, the first time I worked with this program was with adolescents who are 9 to 11 years old. And then, so for my, had to eventually expand and look at a different age group. And so that's, you know, 7 to 12, that's middle school and high school aged youth. And so just kind of had to figure out what was more appropriate in our activities and what's age appropriate to talk about. And then also had to expand to a different community who had a few different ideas on what their own cultural values were for their community and what activities were appropriate for their community, which is in different parts of the state. And the real like basis of the program that we've been developing is kind of here in this figure. It's based on the Bronfenbrenner's ecological systems model. But we talked a little bit about, Dr. Russell did, mentioning that vulnerability is due to context and not like an individual kind of issue usually. And so this program is really addressing the kind of historical and contemporary attempts at eradicating Indigenous identity. There was actually just a report released yesterday or the day before from the Department of the Interior on the boarding schools that took place in the United States. And so I haven't had a chance to look at it yet. So, you know, that's just something that's kind of like, we're still looking at and finding out the extent of these atrocities today. And so that history of attempted erasure of identity has really had an impact on youth today and all levels of our systems, individuals, communities, policies, and that impacts health in turn. And so the idea here is in the figure is with the bolded words, I tried to
kind of recognize how after-school programs, and this after-school program in particular, works at all levels of the system to impact health for Native youth. Starting with the individual, you have your own experiences, the microsystem, you're interacting with your peers. And in this program, it's in a positive kind of, it's in a positive way that you're learning together, you're learning about your cultural identity together and can ask questions and have those experiences. And then we have the mesosystem, which is your interactions between like schools and peers and individuals. The exosystem, and with this, there's that emphasis on local community members. And so with each of the sessions being led by a cultural knowledge holder, it really gives the youth an idea of somebody who is a positive role model in the community, who they can interact with on their own time or within the program. And then also after school programs, which I didn't know much about. I grew up like outside of Tucson. And so we were just out in the desert after school and running around with our neighbors. And there weren't any like after school programs that I knew about. But since working with the Boys and Girls Club, I just, recognize how huge of an impact after school programs can have in providing a safe space for youth. And then, outside of that, the macro system, which is all inclusive. Culture is something huge that impacts every part of our lives, whether you're Indigenous or not. And so that's kind of how I envision this program working to impact health, and what I'm looking at right now. And so in the future, I'll be working with some cultural knowledge holders in the community and doing some in-depth interviews about how they view this relationship and what they think is the importance of these lessons and cultural values. And so that's what I had for my own research. And so now I would love to invite my panelists up here, and I will introduce them, but I just wanted to say I really wanted to have a kind of cross-cutting panel. So I was really intentional about who I was trying to invite. And so we have different like sectors represented in their panel. And so myself and Dr. Teslakai are, researchers. She's at ASU, I'm here at NAU. I work with after school programs. She works within schools. Tamara Little Salt Butler, who works for the county right now with the Healthy Families Program, and Justice, who is a case manager at Native Americans for Community Action, or NACA. And so with that, I would like to invite up Dr. Monica Teslakai. She's a former William T. Grant Scholar, a Native Children's Research Exchange Scholar, and the recipient of 2 Ford Fellowships. She's an enrolled member of the Zuni tribe, and prior to obtaining her doctorate degree, her on-the-ground involvement in juvenile justice led to her interest in studying children's cognitive development as embedded within their social and cultural context and biosocial stresses. She uses a process model approach to examine how children's daily activities and stressful life experiences impact executive function development and both directly and indirectly influence well-being. Thanks. Thank you. Yes, I think so. Can we pull up Dr. Teslakai's slides?
So I just want to say it's great to be here. Cache, I'm, as she said, a member of the Zuni tribe. It's a good day today. It's my dad's 78th birthday, but unfortunately it was taken from us 11 years ago. He was killed in a hit and run, but it's still a good day because it's his birthday, and I feel like he's here with us. And he, being a part of my culture, always saved me as a kid growing up, because we would go back and forth from Tucson to our reservation for our ceremonies. And what always motivated me to do well in school and to become a researcher was working directly with kids. So I feel like even though I'm an academic now, I very much relate to working in the field. I used to be a juvenile probation officer. After I graduated from college, I went from one of the worst performing high schools in Tucson, Sunnyside, to the University of Notre Dame. Graduated in 3.5 years, went back to Tucson, became a juvenile probation officer. Well, before that, I ran a treatment center for severely emotionally disturbed boys in New Mexico. Then I became a juvenile probation officer in Tucson. I worked Pasco Yaqui. reservation, the Tanatam San Javier district. And so for me, I would get so angry because the message I would hear the kids being given is like, you can change if you want to. And I would go into their homes where there's no electricity, no running water. I would have to intervene with grandmothers and grandfathers and parents who were drinking alcohol because of the legacy of genocide, and telling the kids they could drink with them. And I'd be like, no, he cannot drink with you. He's on probation. I'm his probation officer. And she's like, we don't need your white man's law. You know, I would have arguments with grandparents like, okay, but think about what's best for him right now. So for me as a researcher, I've really been motivated by trying to change the message for our youth that it's not a genetic predisposition. It's the legacy of chronic stress and trauma, and our culture is our medicine. Our culture is our way to overcome this. But even as academics, we struggle in this setting. So, sorry. Go ahead.
So Dr. Tesla is going to talk for a little bit about her research, and then we'll bring the rest of the panel up.
Yeah, so I just wanted to share a couple slides. I don't want to take over the whole talk, but I just wanted to share a couple of slides of the work I'm doing now. I'm getting older now, so I need reading glasses every now and then. But I'm looking at how cultural knowledge buffers children from chronic stress. And so in my most recent study funded by the William T. Grant Foundation, I was looking at urban American Indian youth. I tried to work with tribes. I'm so impressed with Amanda that she's been able to get into tribes because many tribes now won't let you come in because of abuse by past researchers. And I'm particularly interested in chronic stress, as I said, because of my background working with youth. And I wanted to get a measure of chronic stress, a biological measure. So I was taking hair samples from kids to measure how much cortisol they're secreting over a 3-month period. So originally I wanted to do this work as longitudinal with 3rd graders and follow them over 3 years. But in my first year of recruiting, I only got 50 kids to sign up. So then I had to make it cross-sectional. So now it's 178 youth, ages 7 to 15 years old, 98 girls, 80 boys. I had membership in 15 tribes. I was able to collect 123 hair samples to measure toxic stress. And so hair is sacred to American Indians. So that's another thing that I had to be mindful of and aware of. One mother told me I could cut her young boy's beautiful long hair. And she said I would be the first person to cut it because you only cut hair for many tribes for ceremonial occasions or to mark mourning, the loss of someone. And so I went to go take my little hair sample. It's not a lot, it's just like this much hair. And I couldn't do it. And I said, I can't cut his hair. And she started crying and she was like, I was gonna let you do it, but I really didn't want you to. And I was like, oh my God, I'm so glad Creator told me, do not cut this little boy's hair. So I didn't do it. So -1. So 123 hair samples. And then I also did qualitative data to a photo elicitation task with follow-up interviews. So I asked the youth to take pictures of the people, places, and things that challenge and support them. And so art was a frequent thing that the youth took pictures of. So I just wanted to, can I go backwards? It's not letting me. Okay, so these, the artwork that's in here, can you go back one slide? Is like this is a drawing one of the youth submitted. And then if you go forward, this is a self-portrait one of the youth submitted, and then go forward. This is a picture one child took of her hand, and she wrote on it that she's scared. And I just took 2 statistics. I can't present all of the data because it's not, this talk isn't just for me, I need to hurry up. So if you can go forward. But 43% of the children have experienced a loved one going to jail. 57% have experienced loud arguing and physical violence in their homes. So obviously there is chronic stress. And in our first paper, we're one of the first to be able to show that children who are experiencing stress biologically through hair cortisol, increased hair cortisol concentrations, what we showed in this paper, which is published in the International Journal of Stress, which is an open access journal, so anybody can get my paper and read it. But what we showed is that children with higher levels of cortisol had impaired executive functions, which are working memory, your ability to take multiple sources of information and combine them in mind. And they also had poor cognitive flexibility, so not able to switch easily between tasks. And if they had poor executive function, What that then led to was increased symptoms of PTSD arousal through working memory, indirectly through working memory. And then they also had increased symptoms of avoidance, PTSD symptoms of avoidance and intrusion through cognitive flexibility. And so in the paper, I talk about the fact that American Indian, Alaska Native youth are disproportionately expelled and suspended from school. And yet these kids are coming to school biologically primed to act in a way that's going to get them suspended or expelled because they have this heightened cortisol levels. It's heightening their arousal system and it's making them very reactive. And so instead of punishing kids, we really need to help them buffer this chronic stress. So we need more programs like Amanda's. I'm like, how can we work together? Okay, so in that first model, culture for me is the missing variable. So in our future work, now statistically, the issue is a small sample size. So when you have a small sample size, there's only so many things you can show statistically. And the kinds of things I want to show are like, you need a lot of what we call statistical power. So you need a large sample size. I only have 178 kids. So I'm parsing this into pieces because I can't, like what I'd like to show, if you go back in this model, is that culture could moderate the relation between high levels of stress and poor executive function. But I don't have the power to do that. So statistical power to do that. I need more funding and bigger sample sizes. But culture is the missing variable for me. This is our Shalako and our Koyemshi, our mudheads. So our Shalakos and the Koyemshi, they come to us every year through Shalako and they bless our people and we pray for the world and we pray for peace and harmony. And the Koyemshi, the mudheads, what they do is they used to shame the people and control them through, if you did something bad, they would make fun of you in front of everybody. And then we also have what we call Salamopia. And what they do is they carry long swords. And if the community knows you're sick, they used to be able to just beat you for it, or you were bad, they would beat you for it. They could also beat sickness out of you. Now it's more ceremonial. You just walk up there and you go through a line of like 12 of them and they'll beat you with the stick to help you. It's like confession. You know, if you know you've been bad, you just go through and let them beat it out of you and you can start the new year. But there's lots of research that show culture is protective. So I'm going to move forward through that. And so in the paper we're working on now, what we're showing is that for kids on the bottom axis, you can't see it, but for kids who are high in stressful life experiences, like having a loved one go to jail, experiencing violence in the home, when they're one standard deviation above in cultural pride, the relationship between experiencing lots of stressful life events and post-traumatic stress arousal symptoms basically goes away. It's only for the kids who are low in cultural pride that you see more stressful life events is predicting more symptoms of PTSD arousal. And next slide. And if you go to the next slide, on the bottom, you can't see it, but what it shows is that kids with higher, it's cortisol levels. So kids with higher cortisol levels, if they're one standard deviation below in cultural pride, they're showing more post-traumatic stress arousal symptoms than kids who are one standard deviation above in cultural pride. So cultural pride basically knocks out that relationship between stressful life events and high levels of cortisol and developing PTSD symptoms. So now this is cross-sectional and very exploratory. So take it with a grain of salt, but I have, I don't know, at least hopefully 15 more years in my career to continue to follow this path and develop a much stronger foundation for being able to say these things. But this is beginning a first look at it. So still important to me. So I just wanted to share some of the youth voices on why culture is important to them. And if you could just go forward. So one of the kids said, my grandma and my grandpa teach me about culture. They're both this nation. They went to the boarding school when they were little kids. They told us what it was like, teaching you the ways of how outside really looks like. They both teach my family and I to make sure to keep the generation alive. They pass it down. They teach us some words, take us outside, tell us we're not always going to be city girls. And the next youth said, the tribe is about, I think it's about my culture, who I am, and be myself, but you can miss whatever you liked in the past or something, but my grandma tells me something about our culture. And I really like our culture too, because it makes me feel strong in my culture. Next one. Running is very cultural. I always say I'm only half Zuni. So I've only done half marathons, but all my cousins, they run marathons all over the world. And they're really good at it. But running is cultural. Running has always been a part of us. We always run and we always find our ways, and we all have our own beliefs. You just run for like everything. You just run for, I guess it kind of reminds me when you start, that's when negativity comes. But when you start pushing yourself, you're getting more positive thoughts. You're getting like flashbacks of how people have positive thoughts on you. And you just keep running, and it's like you're on a shore, but you started to walk on water. And you can't see the shore, but when you turn back, you see how far you've gotten and how you got strong and how you could manage it. And you can see that you could do the impossible. And if you just keep going, because I don't want to take more time, just go to the end. I like this last one. Next one. I was talking to one of the youth and he goes, I said, do you think being a tribe influences who you are as a person? He goes, yeah, how? Like it can. Every time when I go to a powwow, it just looks amazing what we used to be. And I say, we still are. And he says, yeah, we still are. So it's such a gift to be able to work with the children and give them positive messages. So that's what makes my life. So thank you guys.
Thank you. Yeah, that's good. And next, I would like to invite up Justice Castroverde Moniz. Justice is Kanaka Maoli and a Native Hawaiian, is a case manager for the Reach Your Life program at Native Americans for Community Action. The Reach Your Life program seeks to promote protective factors and reduce the risk of suicide. And the primary intent of this project is to serve American Indian youth ages 10 to 24 within Coconino County, which includes the Navajo Nation and Hopi tribe. And next, I would like to invite up Tamara Little Salt Butler. Tamara is the program manager for the Coconino County Healthy Families Program, a family support program designed to cultivate and strengthen nurturing parent-child relationships through weekly in-home visiting services. Prior to the Healthy Families, she worked in the field of youth development for close to 15 years as a unit director, area director, and a vice president of Native American services for the Boys and Girls Clubs located on and off Native lands, including Navajo Nation, Wallapai Indian Nation, and the Salt River Pima Maricopa Indian Community. And she also co-directed the Stanford Medical Youth Science Program while attending Stanford University, where she holds a Bachelor of Art in American Studies with a minor in History, and also obtained a Master of Public Administration from the University of Phoenix. And so thank you all. So glad to see you up here. And I know I just gave some introductions, but my first question was to introduce yourself. If there's any way that you wanted to introduce yourself that I didn't include, and tell us about your work and experience that relates to cultural engagement and positive youth development.
I guess I will start. So good afternoon. She Tamara Little Salt Butler Yunshia, but Ethni a Nishlodo Toragini a Bashashin, Kitligini a Dashache do Ashi Dashanella. So I just introduced myself with my clans. That's something definitely fundamental to my people, the Navajo people, and to other Indigenous people. And I think my work with cultural engagement actually began when I tried to be a teacher. And I just talked with the individuals at my table about this for a brief period of time. For about 6 months, I actually worked on the Wallapai Indian community as a 4th grade teacher. It was right after I had completed my bachelor's degree at Stanford. And I figured, oh, it's going to be easy, piece of cake, because I'm Indigenous, so I'll be able to connect to the kids who are also Indigenous. And I also had taken a break during my college time to actually run a Boys and Girls Club. I actually started up a Boys and Girls Club when Boys and Girls Clubs of the Navajo Nation opened up. And in my community, we started up a club. So I had about 3.5 years background with that in the field of youth development. So I thought as a teacher, it's gonna be easy. I can connect with the kids, but it was not. I really thought that I could engage kids with using my clans, but not realizing that, you know, I had this naivete, I guess, because I couldn't connect with the kids because I wasn't from their community. I didn't understand, even though I was Indigenous, I didn't understand the norms of their community, nor understand what if they even had clans, what their cultural structure looked like. And so, so I didn't, I struggled a bit that year. It took me a good solid 6 months to build that rapport. By that time I had left. And I actually went back, I crawled back to Boys and Girls Club because I felt like it was easier for me to connect with students on that level. And so years later, when I had the opportunity to meet with Amanda and our branch director at the time for the Peach Springs Club, it was just such a perfect fit. And that's where we really started to explore how can we engage the youth up there through the Boys and Girls Club youth development setting through a cultural lens, because we definitely saw that that was the need.
Hi everyone, I'm Justice. Pronouns he, him. I'm from Maluku, Maui. So I'm from a island community. Right now, I'm a case manager at NACA for the Reach Your Life program. We're a suicide prevention program, and our goal is, to make Coconino County a suicide safer community. So what we do is we try to attack that from multiple points by training staff in school, from teachers to janitorial staff to bus drivers, as well as the referral services, which I do. So that's to get youth with behavioral health services. A lot of my experiences working with youth comes from back home, working with Native Hawaiians. Amanda introduced me as Kanaka Maoli, and that's a way to say Native Hawaiian. I just wanted to clarify that so you understand that. So my first experience working with youth, that's where cultural engagement really took off for me. So I worked for a program where we took at-risk youth who were dropped out of school, and part of what we did is we helped them with getting their GEDs. So we had curriculum, they had set things that they needed to get done so they could pass that test. But what I did, I could add a little sprinkle of fun. So I taught them about Hawaiian political history. And it was good. I think as Indigenous people, we all know how disconnected some of us can be sometimes because of what happened in the past. And a lot of those kids that I worked with, they didn't know about their culture. Just like myself growing up, I didn't know a whole lot. I had to go to college to discover that. I had to take classes to learn the language that my ancestors spoke. So there's all of that. So I tried really hard to make sure the children I worked with there could understand that. Once I was done there, I worked for Child Welfare Services as a case manager. Cultural engagement there was a little less because I was more focused on their safety and how they're doing and how they're being cared for by their current home. However, whenever I visited, I made sure that the foster parent or the current guardian was, educating them about their culture and not pushing their own views and ideologies on them. Yeah, thank you.
Yeah, I just want to share that I, as a high schooler, worked with the Boys and Girls Club too. Like, helped me stay out of my house and work with the kids. I was always a smart kid, so I was a tutor for all the kids at the Boys and Girls Club. And it helped me a lot with my dad grew up in boarding school, so he had a lot of trauma that he carried to us. And so, for me, working with kids as a juvenile probation officer, I also would try to teach them their history and the Mexican kids, because this was in the 90s when gangs were huge and it was all about brown pride. And I would tell the kids, this isn't Native pride. This isn't who you are. This isn't what your ancestors want for you. And I would teach them, and they would always tell me, you're crazy, miss, but I hate you because now I got to think about my life. That's like the best compliment I ever had, that they hated me.
And Tamara, you are also involved with the Healthy Families program with the county. Can you tell us a little bit about that? Like, do you have any chances to incorporate any cultural engagement through that?
So I actually started with Healthy Families in October, and so I have a short window of opportunity. So, but we're looking at doing so much in the similar way that we have done so with Boys and Girls Club. And I should note that I was just speaking with my table earlier as well about this. I did make somewhat of a career shift because within Boys and Girls Club, as Monica mentioned, there we have, we're challenged with kids that just have different circumstances, right? And that can result in certain behavioral challenges. And as a staff person, then, we always used to have our side conversations in the staff office, talk about, we wish we could actually have a club for families, for parents. So that way, whatever we're teaching our kids in the club, then that those similar values could be taught, or even traits could be taught to our families. And so segue into Healthy Families, that's actually why I started working for the Healthy Families program. So our overall goal is to prevent child abuse. And we primarily work with mothers and fathers for mothers who are pregnant or who have had a baby up to the age of 3 months old. That's when they start to enroll, and then we get to work with them for about 5 years, completely free, voluntary. They can exit anytime. But we have amazing family support specialists that come in and offer family support services through weekly in-home visits. But what I'm astounded by HFA is that they recognize that we have families that have overcome adverse childhood experiences themselves. And so our overall goal is to teach them and support them as they relearn emotional regulation skills and so on. And so again, overall goal is to get them to just, again, seek out resources, empower them, provide them with that support so that can trickle down to their kids. And so when their kids are within their home, they're being supported by their families in a healthy way. Again, with the overall goal of preventing child abuse. But yeah, so we're definitely looking at ways, since we serve an Indigenous population here in Flagstaff, we're exploring ways that we can partner with the Navajo Nation as well as the Hopi tribe and look at ways that we can indigenize our curriculum a little bit.
Thank you. And kind of skipping around here, but you mentioned the importance of the role of the family, and that was kind of something that we know as Indigenous peoples in our community. And with my research, we've been thinking about how do we get like the families in here. This would be a good family program. And so my next question is, how can we, across different sectors, research, community practitioners, support multi-generational engagement in community prevention or treatment programs or research initiatives? I feel like it's a huge challenge, but
I'll go ahead and talk on this. So I recently went to a suicidology conference in Chicago about 2 weeks ago. And, suicide it's a hard thing to talk about, but it's something that we have to really get used to talking about because it does really affect our Indigenous youth. Suicide rates among Indigenous youth is 3 or 4 times higher than national average. So I went to this specific presentation that they stated this, and I thought it's really important. So they said, nothing about us without us. And so this was a film crew. So they're all natives. They're from Washington. And their focus was to make an ad campaign that showed Native people from youth to elders on their native lands. I thought that was huge and it was important because they're showing how resilient our Indigenous people can be, no matter where we are, and it creates a relationship. I think even though if it's an ad, seeing someone that looks like you, possibly knowing where that video or ad was taken, it gives you more of a connection and sense of pride, and maybe it might help those youth reach out and feel safer to do so. I think another way is to just prioritize having events in the community. I'm not sure what sectors you all work in or what you do, but if you can do little events that could get youth coming and learning more. For example, where our Reshare Life program is hosting a youth Gona, that's the gathering of Native Americans. And so that is usually 4 days, and we're gonna try and pack that into 3 days, and each day has a lesson. So it's belonging, mastery, interdependence, and generosity. We're gonna pack all those things in 1 day. And I believe that's also a way, kind of a way of treatment, because treatment doesn't have to be exactly what we have learned in school. Treatment can be different. Treatment can be, you can be informed by treatment based on the community and what they need. So I think that's really important, is understanding the community and what they need, and then building a model instead of having a model, trying to fit the community into the model. Thank you.
I also think it's really important to make sure that the organization, whether it's, I worked for an organization that was non-native. And so for that type of organization and for an organization that is native, it's really important to make sure that these types of programs are part of the logic model for the organization, so that the organization is proactive in making sure that they're sustaining these programs as well. The problem comes in terms of the lack of trust that tribes have in partner organizations that come into their communities when the program dies and it ends because there's no funding left. And so that's when the community just is like, okay, you're just going to be another program that comes in and ends. There's really no value in it because there's no sustainability. And so to help make sure you create buy-in and also create ownership with the tribe, I think it's important that, again, the organization is very proactive in the beginning and helping to make sure that the program stays sustainable for years to come.
And do you have any aspirations, Dr. Teslakai, of incorporating multi-generational engagement or looking at that in any of your research?
Well, the William T. Grant Foundation has this great grant mechanism where you can partner with community organizations to do your work. And that is one of my aspirations, is to work with Native organizations that are on the ground and develop a winning proposal. They're pretty hard to get, but I do have a little bit of insight since I was a scholar. I would love to work with some organizations, do intergenerational work. I'm really interested in epigenetics, which is like looking at how trauma can influence not just one generation, but multiple generations. And so really pushing myself and wanting to do more community work. And, we all use Bronfenbrenner's model, but I really want to try to indigenize our models and really come from a place of native thinking. And there's this great paper by that Tara Jean Yazzie Mintz helped develop in her Alaska partnerships, but they have this Alaskan Inuit lifeway, and to me it's like Bronfenbrenner, but it's a truly indigenous model, and they bring in ancestors, like ancestors are supporting us. And how would you bring ancestors into Bronfenbrenner's model? But yet for Native people, like for me in my life, I know my ancestors saved me and talked to me, and when I'm really on the wrong path, they push me back in the right way. If we stay open, they give us guidance, but that's not something you can say in Western academia or publish. And so for me, it's really challenging these models of how they think we think and saying, no, this is how we think. And this is science. It's not pseudoscience. This impacts our development. It impacts our health. It keeps us from ending our lives when we are dealing with so much trauma. And so you're seeing a lot of pushback now because of Black Lives Matter and what's happening in the world at large to become more inclusive, but there's a lot of growing pains. So we need more. So anybody wants to get a PhD, come work with me.
To add on to that, it's so crucial. And I think this is what Amanda was so successful at with the tribes that we worked with was just making sure that you seek out input from the community for the program design. And so talking to the kids, talking to the elders, talking to parents, and then talking to the tribal council and getting tribal council approval. I don't know if you recall that time, we actually had a presentation to get approval from one of the tribes, and it was definitely, it was a nervous time, but it was definitely really empowering to hear the feedback from the tribal council, the input that they gave to help make the program successful. And I think by doing so, we were able to have the tribe feel like they have ownership in the program design too. So that created and opened many doors for us.
Thank you. It's funny, Monica's talking about the Bronfenbrenner model. And when I present on this research with my community partner and show like the table and the Bronfenbrenner, she'll, say, won't call it like the Bronfenbrenner model, but she'll say, this is our way of life. And in her language, this is like these values, and this is like our way of life. And this is what it means to be a whole person. And so that's what's important. And so it's not necessarily, in the community, they're not going to be calling like, oh yeah, that's Bronfenbrenner's model, this is our way of life. And so that's kind of, that indigenous model, it was there. It's not, it's been there for millennia. That's not innovative, the way we're describing it in academia, and kind of like knocking the doors down and saying like, this is what it means for Native people to be whole and healthy. And it's including like this strength and cultural identity. And so, yeah, just with the intergenerational engagement, one of the most inspiring times for me when, I was running some of these program sessions or observing and kind of like get a little down. So sometimes it seems like the teens aren't paying attention, and so, but then after each of the sessions, there was always at least like one or two teens that would go up and talk to the cultural knowledge holder and ask how they could become more involved in that specific activity. And so it was just that thing where something connects with somebody and they want to learn about it further, or in case it's not their time yet to kind of absorb that lesson, they know who to go to in the future if they want to continue that path. So thank you for that. It's 1:20, but I have one final question before we go to the audience for questions. What are the next steps that need to be taken by schools or universities, research, community organizations to encourage cultural engagement and positive youth development for Native youth?
I can go ahead. So I'm just thinking about as schools, when you're going, or as youth are going to college, I think it'll be important to understand like where they are and the indigenous people that were there prior, to what is developed to now. But not only that, but taking that further, maybe having a mandatory course in their freshman year or something along those lines, to where, or an encouraged course that they can take and so they can learn. Having cultural educators from the area come in maybe twice a month so they can have the firsthand experience, and that can be good for everyone. I think everyone to learn about how other people are, their values, and what they believe and how their perspectives are. I think another thing we could do is, elevate indigenous knowledge, because I really believe that indigenous people, before things were in institutions, they're extremely smart. They're scientists. They had to observe every little thing so they could live on the land that they're on. I remember seeing a commercial one time about Microsoft knowing what to plant, what vegetables at what time based on something. And I remember learning, anyways, in Hawaii, we have a moon calendar, and the moon calendar will tell you like when to plant certain things. And I'm just thinking like, wow, my ancestors knew that before Microsoft put this on a commercial. And like that made me like super stoked. I was like, that's so cool. And I just think we can, having people come in and talk about things like that, we can elevate that And we can maybe put students in like a living learning community outside and having learn interests like that so they can get educated through those ways. I think another thing that would be helpful in communities or in research would be, they have that term cultural competency, right? And I think we need to shift more towards like cultural humility, because a lot of times I think cultural competency, sorry, probably saying that wrong right now, but that's looking at, trying to learn. And so say you're studying a culture for 10 years, right? You might be considered an expert on it, but you've never lived it. So I think cultural humility moves to that, is meeting the people on their level, talking to them, getting to know them, because they lived it. They didn't study it. It's been their whole life. So I think that's something we kind of gotta shift towards more. Thank you.
Actually was gonna say ditto, because in my notes I had written cultural humility is just so very important. I think it's really, even within the academic setting and the teaching and the curriculum, it's really important to acknowledge that even with the academic weight, I guess, or the background or credence, often Native students, when they come into academia, their own wealth of knowledge that's coming from their own culture gets invalidated by their professors, by their non-native professors. And so what that does is it just creates this process where they walk away, or they walk out of the classroom feeling that they don't know anything, not even about their culture. And if that happens enough times, then that has an impact in their service delivery when they do graduate and they go back to their communities. So I think if we know with your research, with the teaching process, again, it's really important to make sure you have that in place.
I guess for me, like, I don't know if you guys are familiar with these, everybody's putting on their email. I acknowledge that we live in the land of all these tribes. And me as a Zuni, I refuse to write it because I feel like that's empty. You can say that and you can feel good about yourself, but what are we actually doing? What are we actually doing to engage Indigenous students, to validate their knowledge, to validate their presence in our classrooms? Nothing. And until we start doing something, I'm not going to embrace these feel good, to me, in my humble opinion. And I'm sorry if I'm offending anyone, but I'm not going to embrace these. You can feel good about yourself because you're saying this, but what are you actually doing? Zero. So that's just me. I've always been rebellious. I wouldn't be here today if I wasn't rebellious, because I would have taken all those messages that, my people were savages. I got that in high school. The Zuni people were savages because we killed a Stevan Moore. When I stood up and said, we are not, we were defending our people in our land. It's a God-given right in America. I got kicked out of school for a week. But, we got to do more. We got to put actions behind these words and these movements. And I'm looking for that day when we do.
Yeah.
Oh.
Well, that's the thing is NAU, like it's used in marketing, it's used everywhere, it prides itself on being an Indigenous serving institution, but we know that while initial enrollment might be high, support students, Indigenous students specifically through to graduation is low. And I would love to hear some recommendations on how, what are some things that could be done to support those students through, because I don't think a lot of professors necessarily, or programs, or even administrative policies are really conducive to the success of Indigenous students. One of my, actually, Sean Reed's husband, Travis, he did some his master's thesis, and he looked at Indigenous female safety, student safety on campus, and Indigenous women did not feel safe in many places on campus. And I would love to hear some like actionable recommendations on what could be done, because I mean, we know that these are transitional, these are adolescents transitioning into adulthood, and that's a really important developmental time period as well. And we need to be able to put those supports in there, especially for a university that's claiming to be an Indigenous serving institution. It'd be nice to be able to put our actions kind of where our marketing is, you know?
I think NAU, I know this is like new news, right? That is offering, what is it, free tuition for families or students whose family make less than like 60,000 a year or something. So I think that is a huge step in relieving some of those barriers. There was, you know, the university just had that the roadmap kind of that they just, the strategic plan that they just worked on and released recently. And there was a group of Native faculty who were contributing to kind of like our demands. And so that was one thing that was included, and it looked like acted upon. There's also other things, you know, hiring more Indigenous faculty to for the students to be able to receive mentorship from, and that would come, you know, in the form of possibly like cluster hires. So it's you would have a cohort of people who are coming in and able to support each other. And so those are like two kind of the things that just off the top of my head that I think are important. I haven't been in undergrad for a while, so it's like a lot of new things, and on this campus in particular that I'm not as familiar with yet. But yeah, does anybody else have any other ideas?
I also, I'm not familiar with NAU specifically, but I think what I found valuable when I was an undergrad was just the opportunity to do research back in my community, and having a department that was supporting that effort, and also supporting just the effort of innovating research that didn't necessarily follow the Western paradigm of thought. I think that was such a huge challenge for me when I was at Stanford, was just trying to fit within a paradigm that I didn't grow up in. And so being able to have support where my advisor or professors are open to new ideas of thought. I think it's hard to articulate that because I can't explicitly define what that looks like. All I just know is I always felt like I had a different thought process than my peers, primarily because, again, I just didn't grow up in that type of thought process.
So I was fortunate to have an experience where I learned from professors for topics like sociology, where we didn't only just have textbooks that are, you know, like strictly sociology. We had books that were from Native Hawaiian activists. And I don't know if there can be like regular courses that all students can take, like general ed courses that students can take, but they incorporate using like Native authors as well. And so they can learn from them as well, not just, you know, the regular text that a lot of students are used to in colleges.
Unfortunately, we have bills we can vote against that are trying to outlaw doing things just like that, having those kinds of books that open up representation and different ways of thinking. You know, the political ads just make me so mad. I can't watch TV anymore. But, you know, one of our Arizona governors who's campaigning on this, like they're going to outlaw any books that are going to upset any people. I'm like, history is upsetting. You're going to outlaw history? Come on. So it's pretty crazy. But I think as a professor at ASU, I teach statistics to the undergrad. They have to pass it to get their degree. So what I do is I try to reach out to students individually and say, and I'm honest, like I struggled with statistics as an undergrad too. And I almost didn't get a PhD because I was scared of statistics, but I was fortunate enough to sit next to Sheila Tobias, who wrote a book on overcoming math anxiety on an airplane coming home one day, and she sent me her book, and that's ancestors and God intervening, right? And I decided I'm going to go to school. And so people used to tell me, don't tell students about how you struggled yourself, because it's gonna undermine your authority. And I'm like, I'm not here for those kids who might feel like I'm not good enough to be their professor. I'm here for all the kids who feel like I don't belong here, because I was with them. And I still feel like I don't belong here. And so it's fine with me. I mean, I have published papers, I have awards. They want to talk bad about me, I don't care. You know, you have to be rebellious, okay? You have to get a thick skin. But, you know, to just be open and honest with the students and reach out to the ones that are struggling. And instead of, you know, saying, oh, you don't belong here, say, okay, what can we do to change things to help you belong here and help you learn? So I use lots of different methods to reach my students. And I just finished every semester. I think I have like, I'm waiting for ASU to investigate me, because I end up with like 20 students with A+, and then 10 with like B's, and then I always fail 2 at least, but that's because they just didn't engage with me. I work really hard for the kids, more than I should. I should be publishing more, honestly. But we just got an NIH grant, so I'm okay. You know, with Stephen Koulis, we're doing a parenting intervention with urban American Indians in 3 urban Indian centers in the US. So, but yeah, I do need to publish more, work less with kids, but that's where my heart is.
Thank you. And where are we at with time, Julie? Do we have a time for a question or two if there are any? Any questions?
All right. I'm a youth coach and work here locally with youth experiencing homelessness or at risk of homelessness. The vast majority of the youth I work with are Native. What advice can you give on how to engage Native youth in an authentic and genuine fashion?
That's a tough question.
I think that you asked being authentic and genuine, and I think it goes back to cultural humility and being okay with not knowing things and asking questions. And so I think that was like, you know, the first thing that popped into my mind is cultural humility and getting to know the people that you're working with. Cultural identity really exists like on a spectrum, which is something that we've seen working with the youth in the communities that I've been working with. Is you might have a Native youth who has never been to a ceremony, doesn't know how to, you know, any of their clans, you know, has, you know, through no fault of their own has no like connection with that. And then you might have some youth who are going to every single ceremony or possible form of cultural engagement that you could. And so just being aware of that and being okay asking those kinds of questions, and if it's something that youth is interested in, finding ways to provide that kind of outlet for support.
So I think too, I mean, one, that's a sad fact, because as American Indians, we're supposed to have government protection through our federal trust relationship with them to have housing. So it's just sad to see so many youth who are struggling. It's just sad for me. Like, honestly, I had to return to my spirituality just to see in Tempe and Arizona, so many people using bus shelters as their homes right now. It's just like, what are we doing as a nation? How do we change this? But for urban Indian youth and American Indian Alaska Native youth, they may be fearful of working with social services. So it's really important to connect them to like the Tucson Indian Center, the Phoenix Indian Center, places where they can feel safe, letting people know that they're homeless and that they need services, and just letting them know that, you know, it's not something to be ashamed of, and help them get connected to the places that can help them. And Boys and Girls Clubs, another good resource.
Here in Flagstaff, that would be NACA too. The Flagstaff TIC or Phoenix Indian Center.
Yes, at NACA, we have a support services program as well underneath our community development. I'm under that as well, Reach Your Life. But they can, they have a case manager there named Fawn, and she's really helpful and she can help people in tough situations like that.
That's such a strong question. And it actually kind of made me a little emotional just thinking about that reality in our community that our Indigenous youth are facing. But I think it's really important that you stay curious and that you stay non-judgmental when you're initially making contact with these youth. So I think it's important to ensure that whatever type of relationship that you're building with them is supportive and it's consistent. The moment that relationship becomes inconsistent, then I want to say that they'll lose interest. You know, they'll consider you as another person that is just going to leave. And I also want to say that it does take time. You're going to have to be patient. I could think of Indigenous youth that I've worked with that have been in similar circumstances within the Boys and Girls Club setting. And, there's staff there that can provide that relationship as well and point them in the direction of different community resources that they could capitalize on. But the main goal is to build that trust with them. So that way they can, when you do point them to a resource, they're going to trust in your contact. But yeah, that's my feedback.
And also take care of yourself because it's hard and you can't save everybody, but all you can do is give them love in the moment that you're with them. That's like what I try to practice is just, I give love to every kid I'm with for however long I'm with them, because that's all I can do. I can't save them. I wish I could. But I have family members I can't save and that's the hard reality. So most of all, take care of yourself. You gotta save yourself first.
Thank you. And thank you, Jason, for that question. We have another online question from Daryl. This question is focused on addressing the well-being of Indigenous youth through mobile health technology, i.e. wellness apps. From your experience, what are ways that mobile health technology can be used to meet the mental health needs of Indigenous youth?
These are good questions.
Can you repeat the question, please?
This question is focused on addressing the well-being of Indigenous youth through mobile health technology, i.e. wellness apps. From your experience, what are ways that these mobile health technologies or wellness apps can be used to meet the mental health needs of Indigenous youth?
Well, those apps would be good working with youth, with Indigenous youth. I'm not sure if there's any like specific mobile apps that like are Indigenous focused. Like I know they're like mindfulness apps, and what's good about that is it's just like right in your hand. So no matter where you are, you could be at the park and having a hard time, and you could go onto your app. I just think that just more needs to be developed to target that specific population of youth and more just incorporate more culture into it and not really like try and tie in culture to mindfulness. I think would be really helpful, and having that on an app would be great for Indigenous youth. Thanks.
Yeah, and I'm not really too familiar. I think that, obviously technology is huge with everyone these days, not just the youth, but with the treatment through mobile apps, I'm not too familiar with. I've heard some kind of, good and bad about mental health apps that I think that if we had any providers in the room might be able to expand on, but I think it's a really good idea because a lot of, youth do have phones and are able to access the internet. Whether the service and support behind those mobile apps are there yet, I'm not sure about. I don't know. Well, okay.
Sounds like a good research question.
I know, Daryl. Well, thank you all. Thank you to our panelists. It was a great conversation. I love learning from you as always.
Okay, I think we're going to get back to our next session. Thank you all so much. And I'm really pleased to be able to introduce Dr. Linnea Evans, who will be introducing her panelists here in a minute. But if I can just tell you some about Linnea, she's an assistant professor currently in the Department of Health Sciences and the Center for Health Equity Research. And Dr. Evans will be presenting her research focused on whether differentials in the reorganization of daily time during the pandemic exist by race, ethnicity, and school delivery mode, and the relationship to psychological well-being. And her study utilizes self-reported experiences of discrimination during the 2020-2021 school year compared to experiences during previous years to assess the changes in exposure and relationships to psychological well-being. Dr. Evans is also going to present some strategies to increase COVID-19 prevention and vaccination uptake among youth, including a crowdsourcing open contest to solicit COVID-19 messaging, which you see out in our hallway with some of the posters. So happy to introduce Dr. Evans, and she will introduce our panelists. Thank you.
Thank you. Oh, I don't like seeing myself up here. Are the slides going to come back up here? Okay. So good afternoon. We're going to take it home for you. My name is Linnea Evans, and I'm going to introduce we have three panelists. One is actually online. So I'm sharing the speaking floor with our youth advisors / artists that really helped guide some of our work that we did over this past year. So we have Amaya Pablo, who is a senior at Flagstaff High School. She is a member of the Hopi tribe. Amaya participated as both the youth advisor to the contest. And she also submitted a winning poem entitled "Only in the Dark Could She See the Light." And it's out there in the lobby area if you haven't had a chance to view it yet. Online, we have Iffy, who is a pre-med ASU junior who loves helping people and promoting welfare. In addition to volunteering at a hospital, she provides caregiving for developmentally disabled individuals and health education as a youth advisor through the crowdsourcing contest. And then we also have Benicia here, who is a 17-year-old and a student at the Bioscience High School in Phoenix, Arizona. She plans to pursue an undergrad in biomedical sciences and to apply to medical school. Both her and Amaya are interested in medical school. So we have some future doctors in our midst. The topic of mental health is very important to her. And she wrote a really beautiful poem as well that's out there in the hallway that won as well in the contest, entitled "If Only You Knew." So I hope that you will get a chance to especially go see their artwork because it's really quite powerful. So in the intro, I think there was some mention of some discrimination data, and I'm not going to talk about that. I think that was like an earlier plan. Really what we're going to focus on in this last little bit is we're going to walk you through some of the efforts to increase youth and young adult engagement in our center's research efforts that we've been involved in over the past 2 years now with regard to the pandemic response. And importantly, what I want to say is that I really see this work as sitting at the intersections of research and advocacy, because I really believe that rigorous scholarship can and should serve as evidence-based tools that we can actually use to advocate for reform and social change. Okay, here we go. So in the fall of 2020, NIH launched this funding initiative to states with the goal of really providing trustworthy information through active community engagement and outreach to people who were hardest hit by the COVID pandemic. And in this particular context, the focus was on African Americans, Hispanic Latinos, and American Indians, Alaskan Natives, or Indigenous, I should say. Leadership really happened from across the state, including our own Sam Sabo here, who really band together with some other folks in the other universities to secure this funding for Arizona. And the statewide effort was really coordinated by this entire group of organizations, which we refer to as Arizona SEAL Leadership. And that includes Northern Arizona University, ASU, Mayo Clinic, University of Arizona. And those are kind of the central hubs, but there are a number of organizations on the perimeter that are also a part of the task force that include many community-based organizations. Each of the 4 institutions that are in the middle really took up some subspecialized approaches. And for NAU, we took a particular focus on youth. Okay. And so before I go any further, I want to acknowledge that this is really a team effort. There were many hands that touched this project. So while I'm up here, it's important to convey that there were others that worked on all different sorts of aspects and brought their expertise, ranging from grant writing to research coordination efforts to development of recruitment materials and webpage design, and all of the important tasks of allocating funds and managing grant logistics. So it's a big shout out to many people who are actually in this room. Okay. So in June of 2020, it's all blending together now, right? But we began to think about this impending importance of engaging youth and young adults in our efforts. In part, this was really fueled by anticipation of parental concern over vaccine safety for youth. And indeed, shortly thereafter, CDC released a report showing that among 18 to 39-year-olds, only about approximately half were hesitant, with 25% on the fence and 25% outright thinking, nope, not going to do this. But we were also working under the assumption that youth are really leverage points, both in families and amongst their peer groups, and could be quite influential in shaping minds. This thinking is really supported by literature on the effectiveness of youth participatory action research, which is really an equity-focused approach for promoting adolescent health that draws on the expertise of youth as they conduct research and improve conditions that really support healthy development. And it was clear that there was a lot of social upheaval, particularly for youth and young adults during this time period. And so this approach actually perhaps may be the best opportunity to kind of amplify their own voices on the social issues that they're really that they have been contending with and continue to contend with, and the solutions that they view as most appropriate for the issues that we're taking on. So this is the only bar graph you're going to get from me today. So this is in reference to this other data that I've collected. And this really elaborates on this last point in that slide, that there's been a lot of social upheaval for adolescents. So this was in April of last year. I collected data from about 1,300 youth all across the United States, because I was interested in all of the components that might be taken away from youth, knowing that the opening and closure of schools was not evenly distributed, and that there are a lot of aspects that are tied to schools that matter to youth in their daily life. So for those of you who are data savvy, what you're looking here at are the marginal effects from linear regression models that estimate the perceived difference in time spent in each of the major time domains discussed previously, or that I'm going to talk about briefly, from pre-pandemic to during pandemic. So for example, if you're looking, this is for females, if you're looking at the left-hand side of this slide, we see that the time in actually providing care to others amplified tremendously and not evenly. And this has been backed up by other research that's been done. A New York Times article came out where the title was No Time to Be a Child, that there's a lot of caretaking burden that is actually picked up by youth in times of crisis to keep a family afloat. And this is especially evident in this slide. And as you can see that there are differences by race and ethnicity. There were a lot of losses in other areas that I think are really pertinent to youth development and well-being. We primarily observe losses in time, both and I'm not going to talk about napping and commute time because that's more complicated, but you can see here in terms of socializing and especially time spent in school-based organizations that there were huge losses in time. This is on an average day. So, you multiply this out, this is significant. And again, the main takeaway here is that this is not evenly distributed across racial and ethnic groups. We see similar patterns for boys as well. When I attempted to collect data on non-binary gender as well, but unfortunately the sample sizes were too small to say much. So our approach was to really look at crowdsourcing as a public health strategy to bring youth into the work that we were doing. In the end, you get products that are community driven and seen perhaps more acceptable by community members. This process involves really soliciting contributions. In this particular instance, the community is youth. Engaging in disseminating those and amplifying those messages out to others. So that's what we attempted to do with the community vote on the submissions that we received. And then really kind of amplifying these messages further in other displays. So in order to guide our efforts, we felt it was really important to bring a core of youth in to advise on the contest and promote it across the state. We reached out to youth-centered organizations to solicit applicants. We got approximately 84 applicants, which I thought was pretty impressive. We selected a diverse group of 14 from across the state, age 16 to 25 years of age. We were particularly interested in older adolescents and young adults. And they were really crucial in providing guidance as we worked to launch the crowdsourcing contest. On the other arm of this chart, the right-hand side, this shows the response that we actually received to the contest. So we received 23 submissions in total, and a good number of them are out in the hallway, but that isn't all. Okay, you're up. I'm going to turn it over to you, Maya.
So this is the flyer we all had hand in creating. One of the biggest things that we had altered to it is what we see when we first look at flyers. So I personally see numbers first, anything that I'm reading. So we made that bigger. We added a little bit of information and we handed these flyers out to like schools, friends, family, and we also had digital versions of it. So we could send it to our friends and they could post on social media so more people are aware. We have also posted some of the submissions we have, and the NAU research team asked the contestants to share what motivations they had for their submissions. So that is also on the next couple of slides.
All right, thank you, Maya. So, so this example that you see before you, this first example was submitted by one of our colleagues here in Flagstaff, although I am in Phoenix, but aside from that, this piece is focused on conveying scientifically accurate information on prevention and vaccination. When they were asked about their motivation for their art, the contestant wrote, "Science is important, and often there is a disconnect between the general public and scientists. I wanted to make a comic strip that people could understand and give valuable, truthful information." Then moving on to the next slide, this second example also comes from a local Flagstaff youth who was only age 14, so that's pretty impressive. And so the contestant wrote, in my picture, Earth is slowly breaking down and getting attacked by COVID-19. But if you notice, he is still wearing a mask correctly and he's not broken yet. The power of yet. My motivation was to put out a message about wearing a mask correctly. A lot of people at my school have not been wearing theirs correctly, and then the next, they were sick. So it really comes to show how important it is to have your mask correctly.
And then we have online Iffy. She's going to take the next couple of slides. I hope if it works.
Hello, I'm Iffy. We had a 17-year-old contestant who basically made a symptom tracking journal. So let me just read their motivation for it. After I got COVID-19 and became a long hauler, I decided to create a symptom tracking journal for teenagers who also were afflicted with COVID. In the tracker, I included a space for teens to include their fatigue, a symptom of their choice, their mood, and their goals for the month. We had a contestant, age 20, who made these 3 pieces of artwork below or in front of you. The artwork is called Hold My Hand Through Zoom. Their quote says, "Hold my hand through Zoom explores our need to connect with others despite the dangers we have faced having those connections. We have found ways to adapt. By working together, we can save lives and stop the spread and find a new way to connect and understand one another. This is why I want to share my work so I can do my part."
So, I think you probably look at those quotes and think of those as just quotes, but those are data points. There's a lot of rich information in those quotes that we are really spending time, Omar and myself, trying to go through and interpret and doing a thematic analysis on. So I want you to think of like, this is useful both in terms of advocacy, but also in terms of really understanding what resonates with folks and what youth are experiencing right now. Okay, so you can see that we got some snazzier content than what I probably would have developed. Notably, we also got quite a bit of content that was focused on mental health and well-being and the effects of social isolation. And I think that's kind of the big thing that I want to push here. So the next steps in terms of disseminating this work was launching the community vote, because we wanted to get this artwork out in front of both friends and family of youth and larger communities. So we launched this community vote and attached some data collection to also understand from the viewer's perspective how these messages were actually resonating and what impact they're having. And that included demographics, vaccination status, their why behind why they chose what they chose in their vote. And from that's where we're really able to kind of decipher what seems to be resonating. So Omar and I are deeply into this data right now, but in the next couple of slides, I'll share some broad strokes from that data in hopes of really convincing you that this is perhaps a worthwhile approach to really kind of put youth voices front and forward above ours and what we think perhaps they need. So there were approximately 250 people that actually accessed the vote, but there were many more people that viewed these submissions beyond that. We had decent coverage across the state and even beyond. And so for the next few slides, I'm going to read some of the quotes that came in off of the community vote to really kind of showcase how this approach is intended to work. So This poem was by a local college student who really issued a public call to action on masking through an analogy about superheroes. And you'll see in the one exemplar quote from a community voter that his words did actually inspire the behavior in others. So the voter writes, "This speaks so well to the child and all of us. We all remember wanting to be superheroes, and now is our chance." And I recognize you can't read it here, but it is out there in the hallway. In this example, the illustrator really wanted to convey what it felt like to be dealing with long haul COVID. And as you can see in the voters' quotes, this was not something that, this was an adult voter that was making this comment. This was not something that the adult necessarily had considered to be something relevant to youth. Seemingly, when we talk about and discuss long haul COVID, I think the image that comes to mind is an adult person. And I think Lydia's illustration really challenges that assumption, makes us think about who has been affected during this pandemic. And then this is Amaya's touching poem, which is another great example of how I think art in some circumstances, not all, but in some, can actually get us closer to evoking empathy and understanding. So this was written by an adult voter, Amaya, who identifies as female and white. And she writes, "I relate to the isolation. I felt not being able to see a lot of my family for a long time. It also makes me think deeper about the many ways in which Native tribes were affected by this pandemic." And in these last two examples, we also see the power of art in raising awareness on issues that I think are really important to you. This is Venecia's poem on the pandemic, and really took a central focus on mental health that really gave pause to this adult voter as well, who wrote that as adults, we're kind of occupied with life ourselves and the things that are upended and not really necessarily thinking about the implications on youth. And this is another example of that same kind of relating to the art in terms of, this was an adolescent voter who commented on how they really felt that this related to their own experiences. Okay, so what's next? We're working through the data to really try to understand if there are certain patterns in terms of what messages are resonating with certain demographic groups, certain age groups, and the like. But we're also really trying to utilize this artwork to advocate for what youth are saying they need. So we have a couple of public displays of artwork planned. The biggest will be in the Arizona State Capitol. And given that it will be in the legislative hallway and that many policymakers and people in authority will traverse that hallway, we hope to use that opportunity to really showcase the work, but also quotes from youth on what they say is still needed and what commitments they want to see from policymakers in terms of the issues that they have raised. And that should go up in August. So if you have a chance, please go by and see it. Okay, so our last few minutes, I actually want to turn the floor over to our youth and young adult artists / advocates and really give them a chance to kind of share their own perceptions on this work. And I promise you, I posed 4 questions to them, but I didn't guide them in their answers. So the words that they have put forth are their own words. So I asked, why did you want to become involved as a youth or young adult advisor? And just so that we all are comfortable, we outlined some of our thoughts on the slides, but they are here to elaborate a little bit more as well. So Maya had indicated an interest in engaging more with peers. And Iffy had indicated a real interest in aiding her community Benicia in terms of sharing how the pandemic impacted her and using this opportunity to really share her experiences to help others. So do any of you want to elaborate further on your points?
Sure. So just to elaborate a little bit on where I stand, I myself really throughout, it's all a blur right now, but just in my second year of high school, it really just impacted me so much to where I was found to be not eating. I was found crying in my room. And I just remember like my mom came up to me and she's like, honey, what's wrong? And I'm like, I just don't want to be here anymore. And I remember getting emotional, but it's just throughout those times where it's like, I felt my most impacted. And I feel that because of really what I went through, I can really relate to many of those who have similar experiences, who have clinical depression, who have anxiety, and really just a mixture of just all these different emotions that I felt in that same period of time. And I believe that in any way possible that I can, if there's any chance that I have that could help save someone's life, or even just help inspire or impact others who are in the same situation as myself, then I would really want to take a hold of that opportunity to really just help them throughout that process.
Thank you for sharing. I saw that you came up on the screen. Did you have something you wanted to say?
Yes. I believe too that helping others helps me to engage with peace within myself as well. Of course, during the pandemic, I also went through this period of just going through the motions, not really quite passionate about anything, just kind of being dull and dark. So with this contest, I did desire to find new ways to apply myself, like keep myself engaged, keep myself moving forward. And I got to do that through video speeches on the different types of COVID vaccinations, as well as speaking in front of different classes and just getting people engaged.
Thank you for sharing. Maya, do you have anything you want to add?
Yeah, so what I said is I wanted to engage more with my peers, meaning I kind of felt like I needed a reason to communicate with other people and just need something to push me to be more active in my community. I felt like this was a good thing to do. And it was COVID related, and I did have kind of a unique experience with that being Native American. So I did get to connect with other communities across from Arizona. I did post a lot of flyers and on Native reservations. So I got to connect with those communities and just be able to see other people and be able to talk to other people, and they can talk to me about whatever experiences they were going through. And I found that saying things out loud is really helpful, and it kind of helps you realize what the problems are, if there are any problems. So.
Thank you. Okay, so the next thing I asked them was to tell us a little bit about their experiences being involved in designing and participating in research and advocacy efforts. Let's see. And they were very verbose in their answers here. So if you had mentioned that it opened up new conversations, Benicia, you indicated again, really, that this was kind of an exchange, right? That you got a chance to share, but also that in sharing that actually could be helpful to others. And then Amaya, you indicated showing professionals how students your age understand and comprehend things around them. So I'd love if you have anything else that you wanted to add to that. I cut down some of your words because I wouldn't fit on the slide. So feel free to add them back in.
Just to really add on, I think it's kind of piggybacking off of what I said before earlier, though. I know that I myself am still going through like a hard time today. I've already had like 3, 4 panic attacks before coming on here, but I promise I'm doing good. I'm in therapy and I'm in a good spot now. But yeah, I mean, it's like, who doesn't want to be in a study, I mean, I'm already in 2 studies as it is. And so I feel like making the choice to want to, give researchers, scientists, or whomever, this valuable information, finding out like how COVID-19 really impacted like our community and like in different parts of the world or even in the US today. It can really mean something, and I find it significant since, I'm helping out others and it's what I like to do in my free time. So.
Anyone else? You don't have to. I'm just saying, if you have more that you want to share, please
Yeah.
feel free to.
I am a visual learner, and a lot of my teachers don't understand that I don't comprehend what they're telling me to do by just having them say it to me. I kind of have to have like a visual aid to help me. And I kind of thought that went in with the poster because the first draft we had a lot of words and they're kind of all the same size. And like I said, when I read, I look for numbers, like no matter what it is, I open the mail and I just look for any numbers, dates, times, like all of that. So I felt that that needed to be more highlighted because I know other people that are learners like me and they look for that too, and they don't really speak up about it and they struggle finding things. So I thought that I gave a different perspective than anybody else.
Yeah, go ahead.
I'd like to comment as well. I was the one that said recruiting for this contest and research opened up new conversations. I know when I went to present in different classes about the contest, teachers often told me they're really thrilled to share this with their students because their students feel like they're forgotten or just not heard, etc. So I think that's really important to just allow people to express themselves, allow people to give their input, allow people to feel in control of their own lives.
Thank you. Okay, so 2 of you, the 2 sitting here, entered the contest and won. So I wanted to give them a chance to talk a little bit about their artwork and their motivations behind the work that they shared.
Okay, so my poem, as before said earlier, is If You Only Knew. And really my inspiration and what really motivated me to really write this was mainly just that sense, like those feelings of depression and anxiety were really like taking a toll on me, like for the worst, during 2020 and 2021. And so at that time, I was usually more of an artist person, like I'm more physical art and not really like literature because syntax and grammar, I can't. But I mean, I still get help from my teachers, so at least that's one good thing. But but to this day, I really just went in Google Docs and I opened up a new document and I'm just gonna write out my feelings, like whether that be sad or maybe like just whatever came to mind or whatever sounded right, and just really something that really emphasized what I was going through. That was my form of inspiration. And so I did that. And so my mother, who is also in the back right there, helped me with the syntax and grammar because again, like I can't. So after that I submitted it, and as in the question, I won, so it's a relief. But just I really thought that like after receiving the email, like I was just in the classroom like, oh OMG, I won. And it really just gave me that sense of confirmation, and it really meant a lot to me because it really stands out. And even just looking at the comments that they left in my slide, it really comes to show like just what we do in our community, whether that be through like a protest or like a simple piece of art, or like what me and Amaya did, just a simple piece of writing, it can really go a long way and can really emphasize like what kind of emotions and a deeper meaning we want to express, not only in literature, which is also a form of art, but it can really inspire others as well, you know, to seek the help that they need, to really build that confidence and just that resilience to want to reach out to others. So yeah, and I'll hand it off to Amaya.
So I wrote about my cultural identity because I was born and raised here, but I did spend every weekend and all of holidays on the reservation with my grandparents. And so not being able to travel there because of like curfews, like mandated curfews, and just like not being able to be around people. My family kind of struggled with that because we were here and we didn't have the opportunity to see them. We did see each other every now and then because they have to come in to get groceries, but we couldn't be there out there as much as possible as we wanted to. And we usually spend the summers there. So that was kind of hard. So I wrote about how that affected me. And it kind of made me realize that I wanted to identify more with my culture than I have been in the past. So just like it kind of embraced that part of me, and it kind of helped me grow as a person. And that's a lot of what I write about. I wrote it as a poem because they're kind of like incomplete thoughts. So they're just things that I felt, and I wanted other people to know that this is how some people felt, because I know other people that have similar situations to me. And I think that most people aren't aware of what we go through with things like this. So I just wanted to share all that.
Thank you both. So I also asked them, you know, what's still lingering? What do we still need to be working on? And they had some really insightful thoughts on that as well. Maya, you talked about passion toward like that there's been sort of a loss of passion towards education that you've noticed. If you commented on paving a new way forward and honoring those who paved the way before us, and really recognizing that there's been a lot of adaptations that have been made over this period of time. And then Benicia, you mentioned that you believe that there needs to be resources at school for anyone that has been similarly impacted, both in terms of mental health, but also in terms of long haul COVID. So anything you want to add?
All right. So again, I've really, since my impact from 2020 to 2021, I've grown a just this strong passion to want towards mental health. And it really just paved like a little just memory, knowing like, although it's like a horrible memory, but I know one day my therapist said like that was a thing of the past, and it's better to remember it as a memory than as something that has like already happened, like a concurrent event, I think is what she called it. I don't know, I have bad memory, but for me specifically, just to like emphasize on like the quote above me, the whole family was impacted with COVID, and I myself, I've gotten vertigo, I've grown lactose intolerant, I've had depression and anxiety, so that's clearly not something new. But and I've just gotten all these different things, and really and my mother and my sister and my dad as well have gotten a lot of things as well. And I feel like it would be really impactful and really helpful to learn like what have other people gone through in long haul COVID, like what are their after effects, what do they have to go through now in their daily lives that they didn't have to. And so I think just doing just those research studies, learning about like how do people react to COVID, and what are those certain after effects that really impact them on their day-to-day lives, can really just help and emphasize not only that COVID isn't just a thing or a virus that really impacts one's breathing and and has taken many lives, but also we can look at it as like a research and see like what have been those impacts for different people who have gotten COVID maybe once or twice or so, yeah.
I said most youth lost a passion towards their education. I found that a lot of students on Zoom would like fall asleep and forget to log out of class, so they were not as interested, especially in the morning. And the courses weren't as rigorous online because they're kind of being empathetic towards the students and how their lives at home were going. So there was not as much teaching. We weren't learning as much. I personally had a block schedule at my school, so like one class was just in one semester. So I think a lot of students just kind of disconnected from that and they moved towards other things, and they coming back to school, they weren't as engaged in their classrooms because they missed out on all of that engagement in the last year. So they have to like reteach themselves how to learn again and how to be like proactive in a classroom.
One thought I wanted to share was basically how during the pandemic we would see, the empty shelves, the empty parking lots, things like that. And that just like takes a toll on your mood in a certain way, like as if there's not a society there. So now that we're coming back, we're trying to reassert ourselves into this new normal. And we need to remember that some people have lost loved ones during this, and it's not just okay, let's come out and party again. Like there are lingering effects. There are all those fears and doubts and worries and anxieties that were going on. They have a lasting impact, and it can be a struggle to just recover.
Thank you for sharing, you all. So those are the questions that I presented to them, but I wanted, to open it up to the room to, ask questions of them, ask questions of me. I'm sure you want to talk to them more than you want to talk to me. But also before we do that, I want to give a round of applause to the families that are in the room that have allowed them to come share with us. Any questions for them? Or me?
Here, Ia as well. I am sorry. Iffy. Thank you. So I work with youth at a recreation center on a daily basis, mostly teens. And one of the questions that I have is, how would you teach adults to be better engaged with teens? How do we become better listeners to teens and other youth? And how can we help empower you to do the things that you want? Because there's things that you guys can't do because you're not grown folks yet. So what can we do to give you the tools to like do those next steps?
So personally, I have a shorter attention span than most people. So I feel like a lot of people my age also have that. So I feel like getting right to the point and then elaborating more on that is more helpful for me to be able to comprehend things. And I feel like that's usually how I speak. I'll like introduce something and then start elaborating on that to like kind of keep that focus and like be able to have that room to ask questions if there are any questions.
For me personally, sorry.
Do you want to talk?
Go first. You can go first.
Okay. Let's see. I work as a caregiver at the moment, and one thing that helps is basically just you can ask if they're able to answer. You can ask them what they like to do, what kind of talents they have, what are their thoughts on different topics, and of course, this contest focused on art, so that could be shown in different ways, whether it's photography, I do some of that, even dancing, just anything you can find they have the slightest interest in, just hammer at it and find a way to connect what information you're trying to share with what they're interested in.
And then to elaborate, that was a really good question. I think I would side with Amaya on this. I too have a short attention span. So one minute you'll see me doing something, then another I'm doing something else. And I think just getting straight and right to the point would be a really good way. But I think as for adults to at least know and learn as to where certain adolescents, kids, or young adults are coming from, I think that they should be growing to become more empathetic and sympathetic, because I know I'm not the only one with clinical depression or anxiety, although it's not diagnosed, but you know, it was there, and by the time I wrote that poem, but in other words, it just really finding like just seeing like a student, for example, you know, not being their particular normal selves. It's, for me personally, it's best to, if I have like that teacher or like that one-on-one supports, whether that be a family, trusted adult, teacher, whomever I trust. It can be a friend too. But I think just learning about where they're coming from, what their story is, and really giving them the opportunities to express themselves, like in poetry, art, or any different type of media, it can really just give them an opportunity for them to express themselves in a way that they want to express themselves, but also at the same time, they're expressing like what their story is, how they came to be this particular person they are today.
Any other questions out there?
Are we on? We have an online question from Lindsay. I am a former teacher and recall the struggle of getting students back on track when we were able to return to in-person learning. Can you describe how returning to in-person learning affected your mental health, whether positive or negative?
So how my teachers reintroduced us to in-person learning is a lot of group projects, and I felt that it was a lot easier that I could have like those casual conversations in between work to kind of ease us back into just being able to sit down and take notes. I felt like just having that sense of community again was really helpful for a learning environment, and just like acknowledging that everybody went through the same thing and that we're all just gonna like kind of grow out of it together.
I think for me personally, just coming back, it was very awkward because for me personally, I like to consider myself an introverted extrovert. When I don't know anybody, I'm just freezing. I don't want to speak to anyone. And I'm just in like this small bubble, and I'm just like, just please leave me alone. But once you get to like slowly know me and, just practice my limits, but still like try to like be nice to me, or even talk about like certain interests, I can become your best friend for life. Like I can ramble on about different things, about my hobbies, and I've gotten a lot of likes and interests since then. But I think just coming back after a full year of being online, it was just very awkward, and it was just interesting to see like not seeing half of people's faces. It's like, do I know you? And so also too, the next year, in which the year I'm currently in, which is my third year of high school, at the beginning I was still kind of like backing off, and I'm like, I don't know you, so I'm just gonna stick to the ones I know. But really, there's a line in my poem where I find that opportunity to reconnect and regrow those friendships. And really throughout like my third year of high school, I'm really just trying to regrow and reconnect and really build back up those relationships I used to have in my first year. And it's been a rocky process, but today I still I still have therapy, and so I'm getting support through that. And the teachers are really flexible, especially getting to my 4th year before graduation. The teachers have been really flexible, and so group projects are really something that really not only reintroduced me to the friends I once knew, but also it introduced me to other fellow classmates that were new to our class, to our small little class. And it really just helped me to grow those friendships as well. And it really helped me to shape the person into who I am today. So, yeah, good question.
Hello. I know as soon as you said teacher, I thought of my friend in Florida who teaches in elementary school. And of course, she ran it to me a lot during the closure about how difficult it was. Like she had to switch back and forth within, it would be like every couple of weeks, she would tell me like, oh, like she has to go back to teaching half in person, half online, or all online. And then there's a standardized test like next week. And, you know, the board changed up again and again. So I know now she's must just be really relieved that everything is a little more unified with in-person learning again. And then one thing I also wanted to mention was for myself, going back to in-person learning was a big relief. I'm someone who appreciates the, what's it called, in-person real-time help. That was what I really needed, since because of all the sciences I was taking. I was even worried about taking an online lab because I didn't want that to bar me from medical school or for my courses on my transcript to not be taken as seriously because of that. So going back to in-person learning just helped refresh my mind, because I'm like, okay, now things are kind of back to the way they should be or closer to it. We're still, of course, growing and growing every day. And then it also helped me with socializing as well. When everything was online only, I tried to set up some Discord group chats, but since it was my first time, I just wasn't really keeping up with it. And there were some pretty small class sizes, so there weren't that many people that said, yeah, I want to have a study buddy or anything like that. So eventually it just didn't really happen, even though I did it for multiple classes, although I set it up for multiple classes. So just going back to in-person meant I could directly see my classmates' faces and talk to them, and just, you know, before class starts, round up their homework and be like, okay, you got this, I got that too, great. I'm on the right track here. So yeah, in-person learning just helped both teachers and students from what I'm seeing.
You're speaking from being in a college setting. So we're hearing both from youth who are in high school as well as Iffy, who has been doing this back and forth in college. Any other questions?
Now, this is probably a really challenging question, but do you think you would have found the same path if there was no pandemic at all, about being inspired to want to help people and kind of find your inner artist with your poetry? Do you think you would have found the same path without the pandemic?
I would say no. I don't think I would have like expressed any of the emotions I had towards like being Native American as much as I would being disconnected from all of that, because I'm not living on the reservation with everybody else. So I'm not like an immediate part of that community, but I'm there a lot. And I feel like being disconnected from all of that made me want to appreciate it more and just be more involved with it. So I feel like the pandemic really pushed me to be closer to my family.
For me, I would say sort of ish. It's a really good question, though. It's funny because for me specifically, I am a really diligent and hardworking student, and I like to multitask a lot. And so I think just throughout if the pandemic never happened, that is, I probably would still be in the same situation, but just, I think just getting to that path of like where I had my downfall would be a lot later than just then, And so I think I would still find my passion then, because I'm still like, I'm going half on being an artist and half on being a writer, but I have syntax and that's not really good at the moment. But so to just illustrate on my syntax, I do so many run-on sentences. It's like I can write a whole paragraph in like 15 minutes, maybe even 10. And so see, and then the other thing is, if you were to give me a question, like write like something in one sentence, I'll give you 3. So I'll give you triple that. But I feel like I think I would sort of be in that same situation, just not in a super fast manner that it was throughout this pandemic, since it was almost like a domino effect for me. Like it was one thing, and then it was another, and then it was another. And yeah, I think with also too trying to balance outside of school stuff, like extracurriculars, doing this awesome opportunity, and then homework, and just having to balance all that, it's a lot. And just to really illustrate how much work I've had to done before I got here, I've turned in like 3 things early, like at least one that was like several weeks early. I was probably several steps ahead from the other class. And they were like, "What? You're already done?" I'm like, "Yeah, is that a problem?" And I think, yeah, just having to like find the balance. I think, yeah, had this pandemic not happened, I probably would have found myself like getting into that rabbit hole of like, I have too many things to do and not enough time. It's my motto now. And like too many things, not enough time. But yeah, I think I would find myself in that situation just later on.
I too believe I would have been in a similar position without the pandemic as well. One thing the pandemic did do was strengthen basically my passion towards medicine and healthcare. Like from a young age, a lot of my family members were in the profession of medicine. So I saw directly like how committed they were to serving vulnerable people or underserved populations. So I was always driven by that. However, the pandemic opened my eyes a little more to just how much the rest of society do appreciate these type of workers. So that just helped me be more grateful for wanting to go into that field. As well, one thing I didn't think as much about before the pandemic was misinformation. So during the pandemic, I saw how strongly divided people were on things I considered basic facts or basic knowledge. So the fact that people would get like certain myths from their families and friends and not trust something that was heavily researched, to me that's felt silly. But through my time as a youth advisor, I understood that like people have their own reasons for distrust of information. So we need to meet that need and come from a place of empathy, basically.
I think we're about at our hour, so I'm going to wrap it here. But please thank our guests. They've their work really is so powerful. And I hope that you are able to see the display in the Capitol when it does go up. It's going to be up for 3 months. It should be up over the holidays. And much like the information that they shared here, we've asked all of the artists to contribute their own quotes so that that can be really displayed front and center alongside the artwork. So thank you.
I too want to thank you all so much. What a beautiful and inspiring presentation that was. I really appreciate all of you so much. And we've had, I think, a really great day today. Thank you to all the presenters and thank you to all of you for being here. And Steve Palmer was going to say a few more kind of words to summarize what we've heard today. And before he does it, I also just want to bring your attention to some more workshops that we're doing too, that are all free and open to the public, and they're all on the back here. We have one coming up on Monday of next week, and then the 19th and June 3rd as well. So I'll turn it over to Steve to say a few words.
All right, well, I was tasked with trying to wrap things up together today. I'm Steve Palmer. I'm actually kind of the co-PI in training on this, stepping in for Bob Trotter. But once again, please give a hand for our amazing speakers today. But so in trying to wrap this up, and this is my, what did you say, 3 sentences in a paragraph, or what was it, right? So anyhow, I think overarching theme, adolescence is fundamentally a period of promise, as we heard from Stephen. The amazing art and stories shared today, I think, provide a glimpse of that promise. Youth are powerful change agents, we heard today, whether promoting health or vaccine use, using chosen name, celebrating culture. Youth can help us, as we heard, normalize diversity, right? All human beings during adolescence are in the search for their identity. It's incumbent on all of us to be supportive of adolescents as they learn and explore the question of who am I? The health of adolescents is directly related to the support of communities. We've heard that today. And that's whether it's parents, teachers, friends, and also in knowing and acknowledging and learning their culture. They identify with one or many communities or cultures. And can we provide supportive and appropriate opportunities for adolescents to explore their culture and their identity? Can we provide safe venues for them to ask questions? We Are Community, the Association for Middle Level Educators, promotes the idea of every youth as they're in middle school being known by at least one adult really well. And that is us. That is us as we are that community once again. But we are individually not the community for everyone or for every adolescent. We may not be able to meet the needs of individuals. That's that importance of us to have cultural humility, right? It's important for us to connect with others, and that's where meetings like this are really important to help us connect, to better help the adolescents connect with those resources and people that may help them find themselves. So help them find their communities, which ultimately helps us come closer to the community or culture with which they may identify, those multiple. So today we learned that helping others also requires being engaged, and our health is dependent on engagement. Adolescents and us, really, we are stronger when we recognize that we are needed, and also acknowledging that we are in need. COVID brought this out with all the challenges. It helped us realize how much we need one another. And this was evident particularly among the adolescents. So once again, amazing efforts from those folks today. Thank you so much. Once again, one more round of applause for our tremendous speakers and panelists. So I do have one little challenging or a challenge to us, parting thoughts. So as Amanda Hunter had mentioned, how can we make connections and work together, right? For Monica, how can we put actions to words? And we see a lot of actions here today, but maybe if we leave here today with some more connections, how can we acknowledge our own vacuum? How can we reach out, get out of our vacuum and start working with others to really help adolescents learn their own promise to really make the world a better place. So anyhow, thanks again to you all for coming today. This was an amazing workshop. So, all right, and hopefully see you at another one. All right.